Shaken.
Yeah, nice to see you. How was your holiday? Looked
It
fabulous.
was good. Thank you. Thank you. I'm
Yeah.
back refreshed and ready to rock and roll.
You were over in what?
Greece.
Were you on an island? Which one?
We did the like the main area first, so Athens,
Okay, yeah.
Canada, and then we went to Santorini for the last couple days.
Yeah, I've been to Santorini and Athens and all that. It's
Yeah.
fabulous, isn't it? I mean, the food was phenomenal, I bet.
Really? We had horrible food.
Did you? Oh my gosh, I had such
Yes.
great food. Oh
I
my
would
god.
definitely not if I had to rate my experience, and this is why you can't always, when you talk about tourism, you can't always go off of maybe one trip because the food was definitely nothing to write home about.
Really? Oh,
Not
I
at
was
all.
like,
I was so disappointed.
that's sad.
Anyway, let's talk about
Okay. Yeah,
headlines.
what's going on? I mean, there's
Lots
probably
been
a
going
lot going
on.
on. Yeah.
I know. So
Feel
one of
it.
the big news items over the last couple days is that the Cayman Islands is now off of the gray list. So this is fantastic.
Big. Yeah.
Congratulations to the government. They have been working overtime to ensure that this has happened. At least, since this government has gotten in, they have been working to remove us off the gray list. So congratulations to the Financial Services Division of Government, Minister Andre Ebanks and his entire team. The PAC government, I think they did a lot of work to really ensure that this came to fruition. So nobody knows how long it will last for. So we'll see. It's almost like, you're constantly chasing that goalpost that is going to be moved every couple months.
Mhm.
So we'll see.
Yeah, but that's good though.
Yeah, that was a bit of good news. So there's a number of lawsuits flying around. Don't know if you saw any of these, to be honest, but we had one by Patricia Bryan. She actually, I think, has a talk show on Bobo, and she's actually suing the RCIPS as well as the Cayman Islands government over what she says was a toxic work environment.
Oh, wow.
Yes, it was quite interesting. 134 pages worth of a lawsuit. A lot of people might know her as also the sister of Minister of Tourism, the Honorable Kenneth Bryan.
Yeah, I was going to ask. Okay. All right. So this is interesting.
Small place. Yes.
Yeah.
Okay. The NRA is reminding people and requesting that you please slow down, especially in construction zones. They're saying, listen, it would almost be common sense that you would do so. But in case you missed the memo, they are working on a number of different projects. And so they're really asking people to slow down because they've got workers out there who are trying to get things done. And, they don't want to get injured. They don't want you to get injured. So just take your time. And they're also calling for responsible driving in the Savannah Newlands area, because this is an area of concern. And they're calling on all drivers who go through that area to remember it is largely a residential area. And there's children, there's a school right there on the main road, Savannah Primary School. And there are children as well who are oftentimes, walking across the street or just walking up and down. And so they're asking you to please just be courteous and to work collaboratively to create a safer, more respectful and secure driving environment for all.
Well, we all know that asking the public to do that does nothing. So they need to take their woes up to the traffic department and let's get some traffic cops out there doing some stuff.
Yep. Speaking of traffic, don't know if you heard about the incident yesterday, but cyclists got ran over basically.
I have something on your page.
Yes.
And did the person stop though?
I think so, because I tell you what, not long after that, I was in the vicinity and I saw the police escorting a vehicle to their traffic division. So I think that was them.
Oh, that's
Yeah. So those are your news headlines this morning. Have a fantastic day.
All right. You too. We'll see you for the Halloween show.
Sounds good.
All right. Bye.
All right. Thank you.
And that is Spilling Tea with Sandy, brought to you by J. Michael. It's time to start.
Thank you. All right. So we're going to go ahead and get started here. Good morning to everyone. Happy Monday. We are back.
Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's community radio. We are still spilling the tea and committed to being part of the change that Cayman so desperately needs. Join Sandy Hill weekdays from 7:30 a.m. for Premier Access, Cayman Voices, Truthful Thursdays, and much more. Cayman's #1 talk show is now bigger, better, bolder, and more than talk. getting results with hot topics, consumer reports, court exposés, and more.
I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold, hard truth.
Now, from the CMR studio in Grand Cayman, live, direct, it's the cold, hard truth. Now, join the conversation on 345-936-2626.
That number again is
345-936-2626.
All right. Good morning, everyone. Happy Monday. Welcome to another episode of The Cold Hard Truth. Hope you guys are doing well. All right. Another beautiful week in the Cayman Islands. Let's go ahead and get the show started here. Good morning, one, and good morning, all. Hope that everybody is fantastic. I see a few people saying, Miss Sandy, where's that link? Don't worry, I'm sending it. Getting back in the groove of things. It's amazing how after 2 weeks off, you can kind of forget. What was I supposed to do every morning again? Those habits, easy to break, huh? All right, we're back in the saddle. Not to worry, we got it. Good morning to Marshall. He's one of those people on WhatsApp saying, send me the link, honey child. I got you, Marshall. Who else do we have here? Early morning risers. Good morning to Miss Vernita. She's back in the front of the classroom. She's normally the first person to say good morning because she was up at 3:41 a.m. saying good morning on the link. Woo! Miss Vernita, you should be sleeping at 3:41 a.m. My goodness. I know the feeling, though. When you can't sleep, you're like, let me just see what else I can possibly do. You know, the worst thing to do when you can't sleep is to get on the computer, turn on your phone or look at your phone, or even read. You just stay put and force yourself to close your eyes and start counting sheep. You ever done that before? How many of us have actually counted sheep? Does it work? I think it's something kind of mundane to do. So in a way it works because your brain just doesn't think about anything else. You just count sheep jumping over, like you do the visual of the sheep jumping over the fence. And next thing you know, you're back off in dreamland. So normally on Tuesdays, we have a medical rundown Tuesdays with Health City, but they're coming on today a little bit early to share some good news with us. Their sessions are always informative. And I'm really glad to have a consultant surgical gastroenterologist here with us today, Dr. Manoj Kumar Rangappa. I hope I pronounced that name right. Good morning, Doc. How are you?
Good morning. I'm happy to be here. Thank you.
Yes, thank you so much.
Yeah, you pronounced it right. All right.
All right. Sounds good. It's always a little bit challenge with some of the names, but Dr. Manoj, if we can just call you that. I believe this is your first time on the program.
No. I've already done one.
Before.
I think maybe in February or March. Yeah.
Oh my goodness. Okay. All right. Well, it's good to have you back. Thank you so much. So today we're going to be talking about quite an important area, I feel. And I've known of a few people who've utilized this service that's offered at Health City Cayman Islands, and they've had fantastic results. But, we want to make sure that people are very realistic about what they're getting into. So that's why I think that these sessions are informative, educational, and of course, people are always welcome to call or send in their questions. We're going to be discussing the topic of bariatric surgery. So, I think a lot of us, unfortunately, are carrying on some excess weight, and we often think to ourselves, oh man, I need to do something to really sort of help myself. Is this something that is anybody and everybody should be thinking about? Who's the ideal candidate, really?
Technically speaking, people whose body mass index, that is the weight for the height. So if it is more than 35, they can be considered for bariatric surgery.
Right.
And those between 30 to 35, if they have associated medical illnesses like diabetes and uncontrolled diabetes or hypertension or obstructive sleep apnea and various other medical problems, they can also be considered for bariatric surgery. But however, this is not the first stop that anyone needs to consider whenever they want to lose weight.
Yes. And I tell you, I'm glad that you said, some of the things that as a gastroenterologist that you're looking at really is, if there's any additional, because there's some people who might have a high BMI, and yes, that's of concern. But if they don't have any other issues, so they don't have diabetes, they're not pre-diabetes, they're, relatively healthy. I guess there's this concept that you can be fat healthy, those people wouldn't be ideal candidates then.
Unless the body mass index is more than 35. Yes.
Right. Okay. All right. So that's the litmus test then, is the body mass index, that BMI.
Yeah, that's too basic a yardstick, but however, that's the first step, in considering anybody for a surgery.
All right, very good. So we're going to go through all the details here, folks, this morning. So tell us exactly what bariatric surgery is, because maybe people aren't really quite familiar with it. And I know that there's different types as well. So tell us a little bit about what it is exactly. Sorry, Doc. Uh-oh. I think he might have frozen there. Perhaps just try that reconnection, Dr. Manaj, for me. And in the meantime, I will help him out based on our lovely slides. I'll be Vanna White for a second here. All right, so folks, bariatric surgery, a lot of us know it quite commonly as weight loss surgery. And it's a surgical procedure that makes changes to the digestive system, thereby helping patients to actually lose weight. It goes on to say that it's actually performed under minimally invasive methods so that there's less pain and scarring and a faster recovery time. And I must say that over the years that I have actually seen people go through this procedure, the procedure has changed. There's different and more effective ways, I suppose, of doing it. Modern technology has certainly assisted in the way in which this procedure is done. So remember, there's like the sleeve procedure. We'll get into all these details once Dr. Manaj is able to log back in. But yes, there are a number of procedures that are the number of changes, my apologies, in the procedures that have been sort of implemented over the years. So let me just see what's going on here. Okay. So I don't know if Dr. Manaj's connection just dropped, but by the way, while Dr. Manaj is waiting to come back on, big shout out to Chuck and Dave. So far, we're good. We're over 8 minutes. I think we're good. So, on Friday, we had a constant restarting of the stream, and we couldn't quite figure out what it was. I thought, me trusting my local providers, and I want to apologize to my local providers because, as it turns out, it actually had nothing to do with them. Tisk, tisk, go figure. So I think I've mentioned this before. For the purposes of this show, really, we have a bit of redundancy built in. So we've got both flow and logic here. And that gives me access, like I'm actually on a dedicated line for the show. Nothing else is connected to that server, to that internet connection. Big shout out to Marlon, AKA my IT guy. And so when I was telling him on Friday that the show kept dropping, he said, switch to the other provider. And I did, and it was still dropping. He's like, that's not your connection. And I thought, well, that makes logical sense, right? So anyway, I'll tell you guys about the solution just here in a second. But Dr. Manaj is back with us. Good morning again.
Yeah, morning. Sorry, the connection was lost.
Yeah, that's okay. These things happen. I was just talking about a little connection issue that we actually had on Friday, but we'll discuss that in a little bit. So there have been changes over the years, Dr. Manaj, with the bariatric procedure, but there's always in truth been more than one type of procedure. So can we talk about what the different procedures are?
Yeah. So there are various kinds of procedures which are chosen based on the individual variables, that is the various tests that we do before the procedure, as well as the body mass index. The we you have we can classify them as restrictive procedures and malabsorptive procedures. So restrictive procedure is where we restrict the amount of calories that one puts in. The classic example is the sleeve gastrectomy, so in which the stomach, which is essentially a large muscular pouch, helping us to store food temporarily and partially digest it, and then push it into small intestine for absorption. So by removing a large portion of the stomach and reducing the stomach to just a tube, we are ensuring that a person who opposed to sleep has an early satiety, meaning that they feel full early, and that way the eventual caloric intake would be lessened, and there is a caloric deficit. After, if say for example about 3 to 6 months, they eventually lose weight, and it is carried on for up to 2 years, where they lose up to almost 70% of the excess body weight.
Wow.
Yeah, so this is the sleeve, and then there are the malabsorptive procedures. Like the classic example is the bypass, in which a portion of the small intestine. Small intestine is essentially the organ where we absorb nutrients. The Whatever we eat, the food we eat is first broken down by various enzymes into simpler molecules such as amino acids, fatty acids, and glucose, which can easily be absorbed by the inner lining of this small intestine. So by bypassing a segment of the small intestine, we ensure that that particular segment is unavailable for absorption. And so whatever we take in, like say for example, we have a sandwich which say contains about 200 or 300 calories. After the procedure, a person would be able to absorb only maybe half of it, maybe 150, 160 calories. So that way, eventually there is a caloric deficit, cumulative caloric deficit, which translates to weight loss, and the body starts mobilizing the inner fat stores. Essentially, the fat stores are the rainy day food for the body, and so that is utilized, eventually losing weight. And over a period of time, say about a year or two, the people with bypass would have lost about 80% or sometimes even 90% of the excess body weight. And then you have the various the biliopancreatic diversion. So this is done in extreme cases where the body mass index is very high, and so this is also a type of a bypass, but it has this was one of the first few procedures which was developed historically. But the problem with this is there is a lot of micronutrient, vitamin deficiencies which can occur after the procedure, and so this has to be carefully chosen before we contemplate it. However, bypass has stood the test of time, the Roux-en-Y gastric bypass, and it is considered as the gold standard of bariatric surgery.
Right. Okay. So we can talk a little bit more about why is it the gold standard versus the other available options?
Yeah. First of all, it has two components. It is both restrictive and malabsorptive. So we divide the stomach into a small portion, a small gastric pouch, and the large gastric, the remnant. So this pouch, which is in continuity with the esophagus or the food pipe, is anastomosed, or meaning joined with this small intestine, the bypassed segment of the small intestine. Excuse me. And the food passes from the esophagus into the small gastric pouch, It stays there for some time, and then it enters the bypass segment of the small intestine. And this ensures that there is both restriction to the caloric intake as well as malabsorption. So because this is a small gastric pouch allowing only a capacity of about an ounce or an ounce and a half, so the filling of the stomach is quite early, and after which, once there is partial digestion there, it is pushed into the small intestine, and the joint or the anastomosis between the gastric pouch and the intestine, we also we can control the orifice between the two between in the joint, so ensuring that only a small portion of the food that we ingest enters the intestine. So it takes a longer time for the food to enter the intestine for the absorption. So there are various restrictive component, and then there's a braking system, and as well as the bypass segment, which disallows absorption of all the nutrients we take in. And also there is a check mechanism with this, where if a person post procedure, if a person consumes, say, sodas or highly caloric or the easily absorbable substances, like chocolates or sodas, colas, so there is some there's a reaction called the dumping syndrome, wherein there is a very unpleasant feeling of palpitations, anxiety, sweating. So this conditions a person away from such foods. So all these components combined make this procedure quite an ideal procedure, and so it's considered as gold standard.
Very, very interesting. So we do have some people clearly paying attention this morning. We've got questions that are coming in. So we have, good morning to Miss Lorraine. Miss Lorraine says, what about appetite suppressors versus surgery? So would you get the same results from an appetite suppressant? Because I guess at the end of the day, it really is the basic calories in, calories out. I know it's not quite as simple as that. There've been a lot of discussion by nutritionists about the types of foods you're eating, the quality of foods. All of that makes a difference, but at some very sort of fundamental level, it does still come back to the calories that you're taking into your body versus what you're expending. So if you're not getting any exercise, for example, and you're not using those calories, something has to be done with them. And the bariatric procedure essentially cuts your intake of food. So you're eating a lot smaller portions because essentially the stomach has been, either cut in half or a small portion. So you can't eat quite as much. And then that forces you to take in less calories. And by extension, that forces you to lose weight. Would an appetite suppressor have the same level of success?
One must understand that the most important thing in any of the, be it appetite suppressors or the bariatric surgery, the most important thing that needs to be considered is the motivation of a person as to the weight loss. As you just can't, catch hold of a person who is overweight or obese and then say, no, this is the bariatric surgery is the magic bullet and you're going to lose weight. But then they persist to have the same lifestyle over a period of time. Say give it some time. Say, for example, in sleeve, after 3 years, and in a bypass, maybe 5 or 10 years, boom, they gain back the weight. So it's that one should not consider appetite suppressor versus surgery as something. It's a person that's the most important, whether how committed they are to the weight loss and how, because of the various medical problems that they can sort out themselves. See, if you're very well highly motivated, then it's just diet and exercise. People have lost weight. Then the problem with that is continuing the diet over a long run is the most difficult part. And similarly with appetite suppressors, nowadays, the Ozempic and various other drugs which have come into vogue. So these offer a chance to lose weight. I've seen people losing weight on them, but there is a kind of plateau after which there is no more weight loss. Also, the problem with appetite suppressors is they need to be taken indefinitely. Yeah, and also some of them have kind of severe adverse effects. That the nausea or the sometimes even vomiting can be quite intimidating.
Right. Okay, we do have a caller on the line. Good morning, caller. Welcome to the program. Hello, caller. I think we might need to give them a call back. I had to plug in the phone. My apologies to that caller. Let's just give them a ring back. So very, very interesting. And I know that Ozempic has been the rave recently for people wanting to lose weight. We're going to perhaps just ask a few questions in relation to those types of drugs as well. But let's go ahead and see if we can get this caller back on the line. I'm sure they had a question for the good doctor. And good morning, everyone. Good morning, Keisha. Carol, Miss Carol's here.
Good morning.
Good morning, caller. How are you?
I'm doing fine. How are you?
I'm good. You have a question for Dr. Manoj this morning?
I do. I was just wondering if he could give us some information on the gastric sleeve and how it compares to the bypass, and which one's maybe the better option.
Okay. All right. Very good. Thank you so much. Appreciate it. All right. So, Doc, I know you were talking about the gold standard, and I think the gastric sleeve is a newer procedure. So tell us a little bit more about that and who would be the ideal candidate for that procedure, and why would you maybe decide to pick one over the other?
Yeah, so gastric sleeve is essentially, it's a purely restrictive procedure. So where these essentially reducing the size of the stomach. Normally, the size we can store about a liter and a half, and sometimes even more than that in the stomach. So evolutionarily, this has developed in times of famine, or where people had during the hunter-gatherer times, where food was scarce, and anytime it's available, you just gorge on all the food and then store them, digest them, and slowly absorb them. However, currently now with the advent of civilization, as well as now with the superstores offering us various processed foods, there's no dearth of food. And also these are quite processed, meaning they're all pre-digested. So the body does not need to work as hard as it would with the natural foods. And so we absorb the nutrients very early, and the gastric emptying occurs early. So now the sleeve gastrectomy, which reduces the stomach to less than half its size, or even it's just about maybe up to 5 ounces, from a liter and a half, that is more than 50 ounces, to less than to 5 ounces, to almost reduces the size by 10 times. So as soon as somebody puts in, they feel full. So this is only restrictive. However, say for example, a person is it's not motivated and lacks the motivation of persisting with the new dietary lifestyle, and they kind of start eating food, then cumulatively over a period of time, that stomach has an inherent capacity of expanding. So the pouch, the gastric, the sleeve which we have fashioned, slowly expands, and I've seen sometimes the stomach expand to almost near normal size, so defeating the purpose of sleeve. So when a person needs to lose a lot of weight, say, I'm just putting it very simply, this is not the only consideration that we take into account. Say the BMI is quite high, say in the 50s or more than that, then sleeve may not be ideal unless a person is very well motivated, and we are sure that they would continue the same lifestyle. I've seen excellent results with the sleeve, as well as poor results with sleeve. So that all depends on the person. There's only one variable there, and that is the person.
Right.
Yeah. So,
Okay.
however, bypass gives, as I said, it gives another additional check mechanism, and also it reduces the absorption. So, in people with higher BMIs, like 50 plus, this would be a better solution than the sleeve.
Yes, because let's be honest, if we had the relevant motivation to do it ourselves, we wouldn't even be considering bariatric surgery, right? So you have to really look carefully. Like I think about my own health, for example, and I know I've got 50 pounds. That would be like ideal for me to lose. However, the doctors have said, Sandy, lose 15 and you're good. From a medical perspective, you'd be perfectly fine. You don't need to lose 50. But I'm thinking, oh, yes, I remember that high school weight. I'm trying to get back there, which I'll probably never see again. But anyway.
It's surprising that how a loss of a few pounds remarkably changes our physiology.
Yes.
Yeah, just a few pounds. You don't need to get back to the ideal BMI is something which is less than 25. It's 20 to 25, 18 to 25. I doubt I think most majority of us do not belong to that category. And so most of them are 26 to 30 is overweight. Excuse me. And 30 and above is obesity. So most of us do not belong to the ideal category, but then just a loss of few pounds, maybe a little bit of effort in terms of exercise, it takes us a long way into good health.
Yes, absolutely. And I mean, there's something to be said for looking at things in sort of smaller chunks, if you will, to digest it, both your food and just your life in general, right? So let's talk about some of the risks that is associated with obesity. This government, and I want to do a big shout out to the health minister. I know that they have been along with the chief medical officer, trying to really do this survey recently where they're trying to get some markers on where we are as a community. And so we had Dr. Gent and his epidemiologist on the program maybe a few months ago now, talking about this really important health survey where they were going around and people filling out questionnaires, that they needed to take your blood sugar levels, they needed to do your blood pressure, they needed to do a whole gamut of additional testing just to kind of get an idea from a small sample size of how healthy or not we are as a population. Of course, I think, I guess if we just want to look at anecdotal evidence, we can just look around the community and probably say that a lot of us are not particularly healthy, but it's useful for the country and the government so that they can plan programming, funding, and so forth to really analyze the exact and more precise numbers of where we are. And compared to 10 years ago, have we gotten worse? Have we gotten better with our health? So some of the risk associated with obesity include type 2 diabetes, obstructive sleep apnea. We hear a lot of people talking about sleep apnea now, heart disease, which is a big one, stroke, high blood pressure, high blood sugar, high cholesterol, kidney disease, and even osteoarthritis. Wow, because your joints are having to carry that additional weight, right?
Exactly.
Yeah. So, a lot of us look at this list and we could probably take off a few of these things that we suffer from. And of course, none of these are health markers that are good. So if you have high blood pressure, that can lead to stroke, that can lead to issues with your heart and other things. So these are numbers that we want to, and disorders and diseases that we want to keep under control. And the way that even cancers, notice that cancers are not on this list, but we've had some of your cancer experts on before, and they have said, we know that there is a link or correlation between certain types of cancers and obesity and your weight. So,
that's
being
long-term risk.
Yes. Yeah. Being healthy, and watching not just your caloric intake, but the quality of foods that you're eating, as well as, getting some degree of exercise, extremely helpful. So Cayman Kind Action Committee is asking about the cost of getting this done. I don't know if Dr. Manoj is in a position to answer that question. Normally Shamari is here.
I think we could get one of our Kifra or Rebecca to get back on that.
Yeah. Okay. Yeah. Normally Shamari answers those types of questions. The doctors don't get into costs. they're the experts to do the procedure for you. Good morning to Miss Daisy. So we've already talked about exactly how the bariatric surgery and weight loss works, like how it actually causes you to lose weight. And you talked about having a high BMI. So if you have a BMI of 40 or over, that's definitely considered obese, yes?
Yes.
Mm-hmm. Okay. Adolescents, this is so interesting. Do we have adolescents that are now having to get this procedure done?
Yeah, quite now the obesity has reached. It's been declared as an epidemic now. So with the change in the lifestyle, essentially, more and more kids are sedentary with their phones or with their iPads or the gaming consoles, and very few of them venture out. Back in the day, it was all our play is all about getting out of the house and playing with, and again, maybe roughhousing with friends. So it was all that kind of physical activity. Now there is very little physical activity among the kids, and as well as easy availability of food. So both of these conspire and have resulted in adolescent diabetes. I'm sorry, obesity.
Obesity, yes, which can lead to diabetes, yes.
Yes.
So some of the benefits then of the procedure include the significant weight loss, but then the aim of the weight loss is to help improve those other health markers, right? So to improve your sugar level, includes improve if you're pre-diabetic or if you're already diabetic. And I've actually seen people who were diabetic actually have this procedure and it sort of reversed their diabetes.
Yes. Recently, yes, especially the bypass, it's quite effective at reversing the diabetes, or at least reducing the number of drugs you put in every day. This particular person, remarkably, she stopped needing both anti-diabetic as well as antihypertensive drugs. The bypass achieved that, yes. And it can happen, in a matter of weeks, or maybe it may take a few months. But then, as the person loses weight, the body kind of readjusts itself. It's the kind of the static mechanisms, various mechanisms that it has. They get reset, and the blood sugar as well as the blood pressure normalizes.
Very good. Now, I know that one of the things that is very, very critical to this procedure is the counseling and the pre-consultative sessions that are available to people. And so because it is still surgery and it's still a life-changing event, I know that you guys do offer this as part of the comprehensive care program for anyone who's interested in having the bariatric surgery or procedure done. Tell us a little bit about what that process entails, because ultimately you're going to be doing a procedure that has the potential to change somebody's life in terms of weight loss. But if they're not changing certain things psychologically and mentally, which leads to change in habits and so forth, it could really be all for naught, right?
Exactly. Yes. So preoperatively, various specialists need to evaluate a person in terms of how their physiological and psychological variables are. Say, for a person with obstructive sleep apnea would require a pulmonologist or the lung specialist services, where they look into how well the lungs are functioning. Because as we gather weight, we tend to retain carbon dioxide. Carbon dioxide is the gas which we exhale out after all the cells respire. And the accumulation of carbon dioxide is detrimental to the health, and it initially you get headaches, and then daytime somnolescence, meaning you keep sleeping every time, you keep dozing off while sitting, and eventually it leads to the heart failure. So that needs to be evaluated, and as well as the mental status, how well they are, how motivated they are. Is there any particular reason why they want to lose weight? Is just the whim or fancy, or are they really committed towards their health? So all these need to be evaluated, and further the physiotherapist as well as the nutritionist and various other specialists, like in a person who's in a heart failure or early heart failure, that needs to be optimized, and the cardiologist services would be required. So all these specialists need to be involved before a person is considered for or prepared for bariatric surgery.
Very good. So lots, folks, to ensure that you're thinking about as a patient or potential patient, if you're considering this procedure. It's not something that you just jump up and do on a whim or a fancy, as the doctor rightfully said. You've got to think about the long-term implications and your commitment really to maintaining this lifestyle, because I know one of the things, of course, Doc, is I've seen people who've had the procedure say to me, they're not able to digest because, they've lost a part of their stomach, essentially. They're not able to digest food in the exact same way. So it requires them to, for example, not sit down and eat just a sugary meal or a fat-filled meal, because then you're going to have problems like running to the bathroom, and some unpleasant things can happen as a result of that, right?
Yes.
All right. So maintaining good digestive health. Okay. Sorry. Just a question that I saw come in there. So we've got everything from eating a diet of fresh fruits and vegetables. And these are the things that we kind of know, but it's always good to stress these again: limiting or eliminating processed foods, choosing whole grains or nuts, limiting red or processed meats, just cooking healthier. So this is the method of cooking, baking, grilling versus frying. And we've talked about, these air fryers, which are still, a better option than the alternative deep frying of food. So, drinking enough water. This is something that I'm struggling with, Doc, but I'm working on it. And getting regular exercise and enough sleep. And I can't stress, this is, again, it's like when the things that you need to do, but you're still not able to do them. It's a sad state, right? But getting enough sleep. Can we just talk a little bit about the importance of sleep when it comes to even managing your overall health, but in particular, just managing your weight as well?
There is yes, sleep is definitely important in terms of if you're sleepless, you have, simply put, you have more time to eat when you're not sleeping. And also it is sleeplessness or insomnia is associated with various other mental issues, like, say, for example, depression. Depression does cause sleeplessness, and it is also associated with binge eating. Because food essentially is a trigger for a dopamine surge in the brain, which essentially makes us feel happy, albeit transiently. But then our mind seeks more and more pleasure with food. So then all these things, like sleeplessness as well as depression, and then eat some food just to feel a little bit elated. Eventually, over a period of time, you gain weight. But however, yes, good sleep habits are essential. But then with the current lifestyle and the schedules, it's quite difficult to achieve that.
All right, very good. So the good doc telling us a bit about the bariatric procedure here, folks. Any further questions? 936-2626 is the telephone number if you have any questions for him. But, eliminating some of the health risk associated with obesity is really what your ultimate gain will be. Can we talk a little bit, Doc, about, there always seems to be some fad diet or fad procedure or drug over the years that have come up. We've heard like the protein diet. We've heard the no carb diet. There've been so many, I think, I can just recall in my lifetime. The latest one seems to be this one about Ozempic. So tell us a little bit about this. We know that Ozempic and Ozempic class of drugs are actually for people who have diabetes, right? And that's what the drug was designed for. It was not designed for weight loss, but I guess maybe a byproduct of it is that people can and do lose weight. I've heard a lot that people, unfortunately, have been using this as a fad weight loss drug. And as a result, the people who really need it to control their diabetes can't even get it. So talk a little bit about this drug and whether or not it's a good idea. I've seen quite a few things that have said it isn't, but to use this drug for purely weight loss purposes.
Yeah. Although I'm not the expert on this class of drugs, the semaglutide, which is the technical name of Ozempic, it is being used of late more for obesity than for diabetes. Essentially, what it does is it suppresses the appetite and then make sure that insulin is better utilized in the body. So the insulin is the anabolic hormone in the body, which is secreted by the pancreas. And it ensures that whatever the food we put in that is converted to glucose is absorbed into the cells. So if this hormone wouldn't function well, then most of the blood sugar will be in the bloodstream, and it would eventually be converted to fat. So that way, the insulin ensures that the glucose is utilized by cells as it's a fuel of every cell in the body. But it requires insulin for the glucose to enter the cell. So if insulin is not functioning well, then this function suffers, and further on, the glucose is converted to fat. So it ensures that Ozempic, by better utilization of insulin, make sure that the cells utilize glucose and it's not deposited in the fat. And also, it also suppresses the appetite. And so every time we have we eat, especially the processed foods with a lot of glucose and simple sugars, and there is a spike in the insulin levels. So we want insulin levels to be after we eat, the insulin level must go up, and then it should come down, plateau, and then come down. But however, with having processed food, it spikes up. This spiking is not good for the cell, and eventually it results in weight gain.
Okay, we do have a call on the line. Good morning, caller. Welcome to the program.
Hi, good morning.
Morning.
Good morning, Ms. Sandy. Good morning, doctor. I was inquiring about. I am a patient of the bariatric surgery of Roden Y, and I'm having problem with sleeping. So if I don't get enough proper sleep, and I have a system that when I don't know if it's through the fibromyalgia and Raynaud's and whatever else I have, I cannot eat sometimes. My stomach closes upon me, it locks upon me. I can't even drink water. I can't even eat food, proper food sometimes. So I'm wondering what else should I do, because I don't know what else to do. I exercise. I try to exercise. I'm not supposed to be doing high impact exercise. I love dancing. I love to do that. And I'm supposed to be doing stretches now. And I kind of put myself out there a little more. And I do. So I'm wondering what else should I do, because they're telling me keep my muscles up because I have osteoarthritis, this fibromyalgia, now this Raynaud's. This is so much. I am so confused. I don't even know myself. But anyway, I am wondering what else should I do, because sometimes I try to eat proper, but it won't go down. So I don't know what else. I don't know what else.
Yes.
To do, because nobody's telling me, directing me.
So the best thing. Thank you, caller, for that question. So I know, Dr. Manoj, I'm sure when people call in, you always say come in and have a proper consultation, because as you mentioned earlier, there are a lot of different collaborative experts and specialists at Health City. I know this particular caller to the program, and she has a number of health issues. So it might not necessarily be specific or related to her bariatric surgery procedure, but it could be other things. It could be medications that she's on. She talked about fibromyalgia and other things that she's suffering from, that we know that any sort of chronic pain can definitely impact your quality and quantity of sleep. So I think she probably just needs to come in and speak to, a few of you, and kind of maybe collectively you can see how best to assist her with the major areas of concern that she has.
Yes.
Mm-hmm. All right, so caller, maybe try to speak with them. It's challenging sometimes, 'cause I know we like to think of our health in isolation. Like we like to think, oh well, I'm doing this one thing, so this should make me sleep better. But there can be so many different things that impact our overall health, that impact our quantity and quality of sleep. That you've got to really, and it's funny because when you go and sit down with a physician, sometimes they ask you questions that you yourself hadn't thought about, and you go, oh yeah, right, okay, I'd never thought of that. And so that's why it's important to sit down with them and have these consultative sessions, because they have a wealth of experience that they can certainly bring to the table. So Garrett says stress eating is associated with binge eating. It's like being addicted to a drug. Well, it is an addiction. So, and not just stress eating, but even overeating, poor eating habits. I always noticed, Dr. Manaj, when I was in law school in particular, it was very, very, sort of apparent to me that coming up to exam time, when I was a little bit under stress and it was like, okay, crunch time, study, my diet habits like just went down the tube. Like I craved junk food and I wanted the chicken wings and other stuff that just was not healthy.
Yeah, I'm sure it has happened to all of us. Yeah.
Yeah. So, good morning to Miss Morna. We do have somebody else asking for the number, so just reminding you all, 936-2626 is the telephone number that you can call. So Miss Morna says, good morning, Sandy. I'm here. So good to see you. All right. So any other questions for Dr. Manaj before he leaves? Someone shares this and they say that they're now a 13-year post-gastric bypass surgery patient, and they are so thankful. So there've been a lot of people who have benefited from this procedure. They might, I've even seen people who lost that initial like 100+ pounds, and then maybe they gained a little bit back, but they're still far ahead of where they were before, right? And that's the important thing. Good morning, caller. Welcome to the program.
Hi, morning, Sandy. How are you?
Morning. Good. How are you?
I'm not too bad. I got back on Friday with a cold.
Oh, no. Hopefully it's not COVID, but the colds these days are worse than COVID. Trust me.
I know. But I was looking in on your show here about the surgeries and stuff. This year makes 7 years for me, actually.
Congratulations.
Thanks. Dr. Sultan was the one that did mine.
Yes.
I was 440 pounds.
Wow.
When I first started out.
Yes.
And my doctor, which is Dr. Robinson, kept telling me, oh, lose surgery, because I'm a diabetic.
Yes.
And I was on tons of medication every day. It's really got on my nerves for years.
Mm-hmm.
And I looked at her jokingly one day and I said, you know what? I've seen people skinnier, like my finger, and they still type 2 diabetes.
Mm-hmm.
So what's the point?
Mm-hmm.
So like she sat down one day and told me you had to go on dialysis and all these things if you don't start looking after yourself and eating more healthier and this sort of stuff.
So you had a wake up call.
Yeah.
Mm-hmm.
And I remember the first time that they scheduled a surgery was being done in Tampa, Orlando, overseas, and I was supposed to go and I didn't. And then they started to do it here, and I decided I was going to go and do it, and it was the best thing I ever did. Believe me. I came down from 400 pounds to 180.
Wow.
Which I was told that was the weight I should be for my height.
Yes.
Basically. But then I said to Dr. Robin, I said, listen, I don't know where your chart is, but I sort of look like Skeletor, and I don't like the way I look. And that chart is mean for white people, jokingly, because black people got big bones and whatever. But I brought myself up to 210, and I've been fluctuating there now for the last 6 years. And I like where I'm at the moment. And I've managed to maintain that. I mean, I worked my butt off to get to where I am.
Yes.
So luckily, I had no complications at all when I did the surgery. Up until now, I have no complications. Thank God for that. But I just want to let people know that, it is something that you have to work on. Because I know sometimes I end up eating too much of something that I shouldn't be eating, but then you have to learn to balance it out, and exercise is very important. I've been off medication now for 7 years for diabetes.
Wow.
I just got tested a month ago, and my body's still making insulin, and I'm fine. You know, and it's not a cosmetic thing. It's more of a health thing. It was for me. You know, but one of the things that I find people struggle with the surgery that cause a lot of issues with them gaining weight back is a lot of loose skin. Now, a lot of insurance companies will cover the insurance for you to have the surgery, but they will not cover you to get rid of the excess skin that you have. And this creates a lot of issues, and people end up putting weight back on because they don't like it. And I think they need to come to some agreement on that. But, you know, but for me, when I spoke to my doctor about it, he advised me to use the, I don't know if you know the tannish looking cocoa butter. It looks like lard, like the lard bits of it. You just put a lot on your skin when you're exercising and stuff, and it helps to track your skin. And that was what really helped me in the long run.
Okay.
When I was losing all that weight, because at 400-something pounds to 180, you know it was going to be a lot of excess skin.
Of course, yes.
You know, so I've seen people had the surgery, had complications and different things, but you cannot have the surgery and then go and sit down and eat a full plate of food. It doesn't work that way because you remember you're juicing your stomach. And, you know, there's just things that you need to basically go into and look about before you actually do the surgery, study up on it. I know there's a course that you need to go see Miss Simone at the hospital before you can actually get the surgery as well. You also need to be seen by the psychiatrist there to make sure that, you know, everything is okay and you're ready for the surgery and that sort of thing. But I just want to advise anyone that, you know, if it's for a medical reason that you want to do this, please go ahead and do it. It's
a life changer.
About it. Yes, it is. It has. Because just the other day, I looked at my passport photo to what I am now. And even sometimes when I fly away, they ask me if it's me because it's a total different person, you know, on that picture. So I just thought I'd just give you a quick call and share this with you because I think it's very, very important. And I've never been happy with the decision that I've made moving forward. All I have to do now is just keep maintaining it. I mean, I don't exercise as much as I should, but I'm still maintaining my weight. You know, so I don't know if the doctor have any questions you want to ask, or, you know, I'm more than willing to share.
Yeah. Well, thank you for that. No, it's always good to hear from people who have done these procedures and have had a success story. I know that everybody's story can be different, obviously. But like you said, the most important thing is you've lost a significant amount of weight, coming down from over 400 pounds down to, you know, basically half that, if not more than half, 200 and odd. And, you know, just trying to manage all of your health concerns. It's great that your diabetes is still, you know, under control and not an issue where you have to take all the medication in relation to that as well. So thank you very, very much for that testimonial just about the bariatric procedure in general.
Not a problem. So I'm trying to see if I can find an old picture of me and send you.
Yeah, somebody's asking the type of lotion. So maybe send that to us if you have a picture or anything of that as well.
Yeah, probably that lotion is the cocoa butter. The cocoa butter. It's not a lotion. It's more like a like a, what can I call this now? It comes in a tub. It's like lard. It's really thick, and you just rub it on your skin.
All right. Thank you so much, caller. Appreciate it.
Thank you, Sandy.
Okay, dear. Thanks. Doc, one of the concerns, and I hear this a lot from people who've had this procedure, is that excess skin, because you lose 200 pounds in a relatively quick period of time. Is there anything that people can do? Is it mostly genetics why people are going to have the excess skin, or, you know, do they have to make sure that they're exercising as the weight is coming off? Is there anything you can do to control the amount of loose or excessive skin that you can do? Because once you've got it, then really the only probably real fix for it is, you know, a body lift is what they call it, right? Where they kind of cut off and take off that excessive skin.
You must remember that the people who have gained weight have gained that over a period of years and not instantly. So the skin has a remarkable capacity of remodeling itself around the structures it covers. So if the weight loss is really, you know, in an acute, it happens in a short span of time, the tendency of the skin to sag is very high. However, it also depends on some inherent capacity of the skin, which actually essentially translates to how well the collagen which is under the skin, how well it disintegrates and reintegrates to form new, to restructure itself over the underlying structures. It varies with with age, as well as the ethnicity, and as well as the acute weight loss. So the best way is to lose weight gradually and steadily, rather than just you lose weight suddenly, say for example 50 pounds in a month or two. Then that's not a great idea. So you need to lose a little slowly, and also that depends on a person. So when post-operatively, when I follow them on the diet, I make sure that the weight loss is gradual, and it also depends on the vitality of the skin. So as some especially under the arms, and as well as the thighs. So these are the places where it can sag, and sometimes around the waist,
the abdomen. Yes.
So, yeah, these are the places. And we just the vitality of the skin is quite kind of the underlying structures, the subcutaneous tissue is kind of broken. Then these are the people who are most likely to develop those flaps and the sagging skin, and they need to be treated separately by a plastic surgeon to take care of them. So the best way is to avoid them, and of course not in all of them we can avoid it, but such patients require the expertise of a plastic surgeon.
Very good. Okay, very good. Thank you, Dr. Manoj. We appreciate you coming on today. I noticed that somebody said, yes, sir.
So the other thing I think I should mention is that the bariatric surgeries can also be done robotically, which essentially improves the precision, and as well as the eventual the quality of the surgery, because the vision, it enhances the vision as well as gives us extra mobility. So that way it ensures that a person gets back to the normal life quickly, as compared to the laparoscopic.
Very good. So, folks, if you have any further questions, or you'd like a consultation, of course, Health City is available. 640-4040 is a telephone number. They actually have a Health City Connect app, which I've been meaning to get installed on my mobile devices. And you can also reach out to them at info@healthcity.ky. So, Dr. Manoj, thank you so much for coming on the program today.
And thank you for having me here.
Yes, and sharing a bit about this procedure. And I'm sure we'll see you again in the near future.
Yes, thank you.
Okay, thank you very, very much. And folks, health and wellness is something I feel like we all need to do better with. We all struggle to a certain extent. And I was actually just last week doing a bunch of tests, and I'm going to tell you guys a little bit about it. Everything's fine except for one test, one number. And it's something called CK, which is my what's it called again? Oh Lord, I'd have to look up what it stands for again. But it's basically one of those things where it can be an indication of different things. But if you're not getting enough of your enough water intake, it's one of those things that can elevate. So it elevates like after exercise. Let me get you the part. It's called creatine kinase levels. So it does increase after exercise. But one of the things that it also, one of the other reasons it can also increase, folks, is if you're not getting enough fluids. So I'm one of those people that chronically throughout my entire life has really struggled with drinking enough water. I don't want to say I don't like water, but I don't like water. It's hard for me to drink water, folks. I don't know what it is. Water is boring. It just has no taste. It's like, but it's essential for life. And it's essential for, our well-being. The only time I'm going to be honest with you that I ever crave water is actually post-exercise or during exercise. So when I go on that pickleball court, and that's because I'm losing a lot of fluids, right? So I'm running up and down, I'm sweating a bucket, I'm losing water. Then I'm like, oh yes, I need some water. And one of the reasons why traditionally you guys see me having water with ice, although it's not good for my throat, is because I've found that it's actually easier for me to drink cold water, right? If it's lukewarm or warm water, I'm like, I want to drink it even less. But because I had to do some blood work recently and this creatine kinesis level came back, people who don't know anything about me necessarily and my overall health go, ooh, that number's high. That's not good, because that can be an indication of like skeletal health, brain health. Like people who have a high number of that might have heart disease or stroke. And I was like, whoa, 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 whoa. Let's not jump the barn fence here. Let's rein it in a little bit. And having spoken to Dr. Benoit at Health City, Cayman Islands last week, and did some additional tests just for everyone's peace of mind. The logical conclusion here is I don't have any of the other symptoms of anything else that's going on. It's just that I need to drink more water. I know this. It's a struggle. So one of the things that I've done, me, and I love me a good, don't tell Marlon this, could be like another container, another jar. I love containers and I love jars. And so I bought more than one of these. This one I like because it's not quite as big as the other one. Like it's hard to carry these around if they're super bulky. But this helps me keep track of my water. And I've had it for months now. This helps me keep track of my water intake for the day. Okay. So it starts like it has a little timer here, 8 a.m. on the one side. And then this is like your afternoon intake. So it takes you from 8 a.m. until 7 p.m. So basically, I have to drink 2 of these for the day. And that might not look like a lot for those of you who drink water. But for me, who struggles with drinking water, this is a lot of water. Okay. So what time is it now? It's 8:36. So I should have drunk, and they have on the other side, it goes up, it's 8 ounces, 16, 24, 32. And then it has like the ml on the other side. So this is a good little one because it really allows you to keep track of your intake. But I got to tell you, so I've just poured out this glass, right? And this will take me to right about 11 o'clock of where I should be with my water intake. So I'm trying, because I need to do this to bring those CK levels down, and proper hydration is good for so many things, folks. Your skin, your organs, everything needs water. Water is, the substance of life. And so it's one of those things that I know for sure is an ongoing concern for me. It's just really hard. It's hard for me to drink water. And then the problem is if you don't drink water, you want to substitute it with other things that are less healthy, like the sodas that we shouldn't be drinking. Ugh. So anywho, drink water. I drank a lot of bottled water when I was in Greece because I was doing a lot of walking up and down, a lot of exercising. And I want to talk about Greece a little bit here this morning as well. So big shout out, first of all, to Health City, Cayman Islands, and Dr. Benoit. I had to quickly get in there last week on Friday, actually, to do an echocardiogram just for additional testing for insurance purposes. Everything's fine. Results came back all normal. But, when you're sitting there doing these testing, you're getting of a particular age and you're carrying a little bit of extra weight, and maybe technically, and yes, we need to admit that we're falling into that BMI obese category. You've got to really start to make some changes. So you guys know that I've been talking about forever and a day, these 50 pounds, well, since last year, the 50 pounds, and we did not make that goal, none at all. But just because we were not successful doesn't mean that we're going to give up now, honey chill. We're going to continue on it. And I have in a box here, and if time permits, towards the end of the program, I'm actually going to do a little bit of an unboxing. I have my latest gadget. Y'all know I'm the queen of gadgets, honey chill. I have my latest exercise gadget, which is a stepper. And so I've been following this lady on, I think she's on Facebook and Instagram, whatever. She stepped her way to like losing, first of all, she wasn't really that big. She was only like 160 something pounds, I think. And so she like lost 30 pounds just stepping. But stepping is hard. I mean, you do that for 45 minutes every day, you're going to lose weight. And, she pretty much is just sensible with her diet. She doesn't overindulge in anything. And she just watches the caloric intake. And, we don't have to be extremists. And so I have the stepper. Now, I'll tell you why I decided on the stepper as my motivation, my instrument of choice during the show, because I've got access to a full gym that never gets used. But we're going to get there. One baby step at a time. We will get there. During the show, I want to do something because I feel like I've got 3 hours. that literally I'm standing here and I'm talking and we're having discussion and, you know, all this great stuff. But I can multitask and do a little bit of exercise. So remember we were trying to do the cycling. That was hard because of the distance between me and the camera and the microphone and trying to hear calls and stuff. But the stepper I could literally put like right here and just start stepping. So it's a little bit more, it makes a little bit more sense. And I actually want to do it during the show because I want to encourage all of you who perhaps know that you need to do a little bit more exercising in your life to say, hey, if good, fat, plump, you know, overweight, obese Sandy can do it, then surely I can do it too. We all can do it. You got to just start with baby steps. And I don't believe in, you know, Rome was not built in a day. So I'm not expecting any overnight miracles, but I believe in one step at a time, honey chill. And so that's how we're going to start. We're going to start one step at a time. And I'm going to be the guinea pig. Y'all can laugh at me and make fun of me all you want, but I'm going to be committing to doing a little bit. Right? A little bit goes a long way sometimes. So listen, yesterday I was out on the pickleball court. So I'm back now, as you guys know, last week. And I went on the pickleball court. I've got to wear my little knee braces, Jill, because somebody sent me a joke this morning. I had to laugh. They said, hold on. Let me tell you what the joke was. They said to me, when people say enjoy them while they're young, they're talking about your knees and hips, not your kids. And boy, can I relate to the knees. Not so much the hips, but the knees definitely feel it. So, you know, I played for a couple hours yesterday. That's not constant playing because it's what's called open play at the pickleball court. So you change off, you know, with people and whatever. But yeah, the knees definitely feel it at a particular age and a particular weight. But I enjoy things like pickleball because to me, you're getting exercise and you're not even paying attention to the fact that you're getting exercise. So your mind is like, oh, just hit the ball and you're running up and down the court. You know, you know, run up and down enough. You're going to start to see some tuning up and a few pounds, hopefully leaving as well. So I'm back playing pickleball. I have a new racket. And so I was testing that out yesterday. And really what I want to do is probably play pickleball like 2 or 3 times a week, ideally, and then supplement it with other stuff. I am at the age now where I don't have to run a marathon or go hard, you know, so things like Tai Chi and yoga and Pilates, like all these things, anything that stretches the body and, you know, helps you to keep limber and mobile and all these things are important. I think that they all have a really important place to play in your overall health. So if you're on my personal page, you know that I share a lot of like Tai Chi related you know, videos and stuff. And those are all like moves that most people can do. You don't have to be super fit to be able to do a lot of the Tai Chi moves. You just have to remain consistent with it. And so many of them are just about flexibility, like keeping the hips and, you know, these rotative movements kind of going. And you just do them 5 minutes a day or whatever. And it really kind of helps. So yes. So good morning to Miss Rosedale. So good to see you. Leroy says to stay off the apple cider vinegar. Miss Olive says that drinking water is a big problem for me, but I try my best to drink it. It really is like a struggle. Miss Vernita says try getting a sip bottle and keep it in your hand and try sipping it. It may help you get into your water intake and get it through. So yeah, so I find that this is a good way for me to keep track of things. And then, you know, I poured out a glass over here today. And so I am probably halfway through this glass. So this takes me into the 11 o'clock hour. So I keep sipping it. And I tend to drink more water during the show because I am talking and that like makes me want water. But yeah. Miss Soka says my water has to be ice cold. I can't drink room temperature at all. Essential water is the very best tasting water, makes it easy to drink. That Aquafina Caymanians love. She is not a fan of that one. And let me tell you too, if you don't believe that water has a taste, water has a taste. In fact, when I was in Greece, let me talk about Greece for a little bit here. When I was in Greece, I had different types of bottled water. And I found that everything in Greece tasted different. You know, it's weird, you think, oh, tomatoes are tomatoes, and what, like, things legitimately taste different. Even some of their fresh fruits and vegetables and so forth really taste different, you know? So, it's just one of those things. And I was like, yeah, this water's different tasting. It's kind of weird. But I just had to force myself to to drink it nonetheless. They have their own bottled water and it's being bottled there. And it was just different. It was like, why does this taste different? And of course, if you're used to something, then your palate is just like, this is weird. But I couldn't use that um, as a reason not to take in water, right? Because it was cool, but hot at the same time. I don't know if that makes any sense. It would like cool down kind of in the evenings, but during the day, when you're up and down and you're walking up, you know, Olympiad and all this kind of stuff, child, it was getting hot, and you're like, oh, I need to hydrate. I need water. So, I was thinking about my Greece trip, and of course, every time I travel now, one of the things that comes to mind is that William, who was complaining about our tourism product. And so I compare what we offer here in our tourism product. It's not really apples to apples, but kind of how things are done, in other places. So of course, I'm not comparing America because that's not really a tourism destination necessarily. But Greece can be. I think it depends on where you are and so forth. So I was sort of thinking about my experience in Greece, right? And what sort of cultural experience did we have? Now, we actually stayed, it was a group booking, as you guys know, and we stayed at a hotel in an area of Greece called Kaneda, which is about an hour outside of Athens. So it was very, very interesting because when we flew into Athens, we had this drive, and you got to see a lot on the drive. I think you can make a lot of observations about countries. First of all, I thought that relatively speaking, Greece is a very clean country. So I didn't see like New York, you see all the garbage all over the place, like how they pile up the garbage on the side of the roads. Cause I don't know, when it's garbage day, it's like, ew, like you see these rats that are the size of dogs trying to steal your children and stuff in New York. I felt that Greece was relatively, like, I didn't see any piles of garbage on the floor. In fact, or on the streets. In fact, I saw a lot of people who were obviously sanitation workers sweeping and cleaning up and that sort of thing, right? So that was interesting. And but one of the things I saw that was off-putting was a lot of graffiti. And our tour guide, as they picked us up on the ride to Canada, she was saying that, they've had very, very tough economic times. And I remember hearing about this some years ago. I can't remember, probably maybe like 5-10 years ago. They had something like double digits, 20 something % plus unemployment. The government was struggling to pay bills. It was like a really, really bad situation. And so she said, a lot of the young people took to the streets and started graffitiing all the buildings and everything. And I thought, well, that's a weird way of protesting. Like, graffiti makes the place look less than desirable. But this was an observation that I made. Saw it quite a bit in Athens, but it wasn't just Athens. It was like all over Greece. Essentially, almost everywhere you went, there was graffiti on the walls and the exterior of buildings. And they don't seem to use a whole lot of paint, which this is one observation that I've noticed, that in Western countries, say, for example, America, right? People paint their houses. In Cayman, we paint our houses. There are a lot of places, like Cuba is one of those places, where normally they just leave it like almost the bare concrete. They don't do a whole lot of painting. Even in Jamaica, I've noticed that in certain places, they'll paint like just the front of the building that is like facing the road. And then the side is just the raw concrete and the back is raw concrete. And it's so weird because I think for me, because I'm used to seeing painted buildings, like when I travel to a country and I see that, I always say, oh, why is that the case? And I remember when I mentioned it to Marlon when we were in Jamaica in June, and we were on the other side of the island, he's like, he'd never even noticed it before. And I said, why don't they paint the side of the buildings? And he's like, huh? He just had not made the observation. Like his brain, his eyes just didn't pick it up. To me, I picked up on it because I thought, that's weird. Why would you paint just the front, not the side of the buildings? Anyway, so I think in Greece, a lot of things are not, like the buildings are not as colorful. Like I found a lot of the homes seem to all just be white, like nobody was really painting. And I'll show you some pictures here to kind of give you an idea of what I mean by this. But let me see if I can show you some of these pictures. But yeah, it was just to me like a little bit unusual. Like, why wouldn't you paint that building, right? So the other thing though is when you don't paint a building and then you add graffiti to it, to me, that's just like, wow, that's just like so, it just makes the place look so incredibly different, right? So here's an example. This building, I don't know if you guys can see this, but let me increase it. You see how this building is just not, I'm going to increase the size here. This building isn't painted, but not only is it not painted, oops, hold on one second here. Okay, so not only is it not painted, but you see all the graffiti that's on the building down at the bottom. So that makes it look even worse, right? It would be one thing if it was just not painted, but not painting it and then adding graffiti to it just makes it look, I don't know what the right word for it is. It makes it look, I hate using the term third world, but in my mind, that's what it makes it look like. You know, I can understand perhaps why some of these older buildings would not have been painted, but then people who add all this graffiti, and I'm thinking, why would you add graffiti to your buildings knowing how it makes it look? But I guess it's a thing now, right? So a lot of the buildings, you know, this is Santorini, which is one of the numerous islands in Greece. Most of those buildings are either not painted at all or they're just painted white. There's not a whole lot of color there. And then they do these blue domes, which has been one of the things that people really love about Santorini, the white and blue, and then you've got the ocean in the background. But I'm trying to show you some more of the graffiti pictures because it really, really stood out. Like here, okay, here's some. This is when we were back in Athens, right? So these are some of the structures now that have significant, you know, and this is common in Athens. All the like buildings and common places and whatever just had a lot of graffiti all over them. So this is one. Here's another one. So this is like walking the streets in Athens. These are like the columns, you know, for the buildings and stuff in the street. And so this was pretty common to see, you know, all this graffiti. And I don't know exactly what it says or whatever, but it was like everywhere. Here's another one, right? And so this was pretty, you know, the buildings are, yeah, here's another area again. So any place that had like a shutter or open space or whatever, it's like people just took to putting up graffiti. And, you know, a tour guide said, oh, they don't even bother trying to remove it anymore. And I thought, okay, that's interesting. But this is, and I want to show you guys because again, you know, people go away and they talk about other countries and, oh, this country is so much better than Cayman. These countries are amazing. You know, the people of Greece seem nice enough and it seems like a nice enough country. But listen, it was not unusual to see buildings like this one here, where the structures are, you know, this is crumbled behind this little zinc partition. This is a crumbling building on the interior. And this is part of like, you know, a main strip in Athens. Nobody occupies this section of the building. It's crumbling, it's falling apart. Derelict buildings, you know, were kind of like, okay, that's just part of the scenery. Like nobody necessarily felt bothered by it. And there was a lot of these sort of empty spaces and stuff in the shopping district. And then, you know, one next building over, even within the same building, you'd see like a high-end store where they're like, oh, look, you can get, you know, Louis Vuitton or whatever. And I'm thinking, this is so interesting because in the States, you'd at least have like the entire building that's like high end. This was like, nope, each individual shop, you know, some shops had all this graffiti in the front. And then, it was different, and it's a different feel when the buildings look like this. But like I said, the streets were pretty clean, by and large. Beautiful structures like this church here. Thankfully, there wasn't any graffiti on this historic church. They probably washed it off, I guess, if they do it. These are, I love these kind of like historic buildings and stuff like that, right? So I thought about my trip in relation to, again, what you expect as a tourist. And so we did a lot of like, here's this bar that had like all these different types of like, I guess, alcohol beverages, but they were all in really colorful bottles. So that was like super interesting to see in Athens. We were just walking by inside and thought, oh, that looks pretty cool. So we went to the wine factory, the wine museum. We had to seek out these adventures. So we went to, the museums and the Colosseum, and we had to seek these things out. It wasn't like, and I'll tell you what, we stayed in Canada at this all-inclusive kind of hotel experience. We had our meals and stuff there. So I'm also very much aware when I talked about the fact that I was not really that impressed with the food. My intake of Greek food was limited to what was available at this restaurant. At the hotel. And, every day they kind of, after like the third day, the menu was so repetitive. It was like the same thing over and over again. I was like, oh my God, so much lamb. I guess they love lamb. I was like, okay, I don't mind lamb occasionally, but I don't want to eat lamb every single day. So this for me, folks, was a traditional meal. This is my salad. I started out every single meal except for breakfast with a salad. So you see, and thank God that I actually love salads because I might have starved while I was in Greece. But, I love salads, and I love, beets on my salad, tomatoes, like all the, to me, the salads were good. But I could see that if you were not a huge kind of salad person, you might have really, really struggled in Greece. I struggled with the breakfast because the breakfast was like, okay, they had pancakes. Even their omelets were a little bit different. Like I wasn't used to an omelet where you just throw the tomato on at the end and it's like, here, there's your omelet. And I'm like, isn't that supposed to be diced up? But again, first world problems. It's we're used to a particular thing. We're kind of spoiled in a way with our palate. We're used to certain types of food, and you're not going to get those foods necessarily in Greece, right? So we had Greek food, but even the restaurants that we went to, I thought, for the most part, it was really bland and nothing to write home about. The food was not the experience here. As somebody said, Chav, if you want good food, go to Italy. And I can imagine. That's on my bucket list too. So, but yes, it was interesting, but we had to seek out these adventures. Like we had to go to these places, right? And of course, having a tour group that has everything organized for you did make it easier because we didn't have to do that ourselves. And it was an amazing adventure. But had I just gone and stayed at Canada, let's just say I'm a regular tourist and I go, okay, I'm going to stay at this Canada resort. If I didn't think, okay, I need to go to the museum, I need to book, going to Pedro Castle, I need to do this. There was nothing on the ride, like if you just jump in a taxi and you go, there would have been no cultural experience. And so I always reflect back on what our recent guest, William, thought of the Cayman Islands and what he expected to experience in the Cayman Islands. And I reflect on that, generally speaking, with, our own travels. And I realized here, folks, that honestly, I would not have felt like I got enough culture or experience a lot of the history by just staying at the hotel. And I think that is true and indicative of anywhere that you travel to. Now, some people said last week, well, Sandy, at least, your people, your taxi drivers and whatever, at least they were Greek. And I said, yes, that's true. Obviously, I don't know what their foreign population is, but I suppose most of the population there are indeed Greek nationals. But that still didn't mean that if you asked them a question that they were able to tell you anything about the culture. We booked these tours. So the group had every day a different cultural experience. We did Athens, we did Corinth, we did all these cultural experiences. So they had different aspects of Greek society and Greek culture. Like here's the lady, they took us to this spot where they told us and showed us all about pottery making, right? So, our National Museum folks puts on amazing events. Just over the weekend, they had a thatch roping seminar class. I don't know how many of you went to that. That was on Saturday, but you can go and you can learn and you can experience these things, right? Pedro Castle has the theater, and you can go through the old castle there and read and learn. Now, what I think we could do a better job of, okay, and this is just a suggestion I'm throwing out there for tourism, is one of the things that I noticed is our tour guide, for example, she's a professional trained tour guide in all these different sites. She can tell us a lot about it. She even walked around with this book. So this book has like pictures in it to show you what these ruins, the drawings of what they probably looked like at the time, the originals versus now what you're seeing. And so she carried around these books everywhere that we went, and she could show us pictures, and she could tell us all about, Zeus and Athena and the history of all the legends and the stories. And, so she was full of knowledge and information, obviously professionally trained. Oh, this is the site now. Oh, yes. Let me tell you, this is the site where I was telling you about the Christians came 1,000 years later. The top part is what they built. This is that site now. This is where they built on the ruins of the Greeks before them, and then said to them, well, none of what you were taught would have been accurate in terms of religion. So she was kind of showing us that. But it was very, very interesting. I got to tell you, towards the end of the trip, I'm like, okay, I'm museumed out. I've seen enough museums. I've seen enough, old, structures. I've walked enough paths now. I was kind of done with that because, again, that's the Greek experience, right? So it's the ruins and their history in terms of that is their culture. So, you learned about the little blue eye, which is supposed to be to ward off evil and whatever. These are just little quaint little places that we saw on the days that we had some free time where we could do some shopping and stuff like that. So again, you have to seek out culture, right? You have to make it a point to go to these historical locations, to go to the this is us here at the olive oil plant, so we can see and learn about olive oil. And I learned more in half an hour from this lady about olive oil than I ever knew in my entire life. Even the fact that we're using it wrong, like when we're using it to cook, and how we're storing it. It should be stored in a dark, cool place. Most of us have it, in light and whatever. So your experience and what you, do on your vacations, I think is largely up to what it is that you're interested in. Now look at this cat. I got to tell you a funny thing about the cats. Everywhere we went in Greece, except for the Santorini, there wasn't as many. There were cats everywhere. In the hotel, we had cats coming in the dining area every single night. 2 or 3 cats would walk in. One night they started fighting each other. They must have been fighting over the lamb scraps. I don't know. But they were fighting with each other. And so I realized that their cats is the equivalent to our chickens. So here how we have chickens everywhere. They swim in the ocean. They show up in your restaurants. They want to come inside your house. This was kind of the same thing that the cats were doing. They were literally everywhere. In fact, one restaurant that we went to, we didn't see quite as many dogs. There's a few dogs. There's like one on the property. He walked with us one night when he walked up to a restaurant about 20 minutes. One of the restaurants, there's this huge dog that walked in the restaurant. He just stood there, and I thought, oh, he must know that somebody's going to feed him and it's dinner time. I don't know who he belongs to, but yep, open restaurant. He just walked through the door, child, and just sat down like, where's my dinner? But there were cats everywhere. So I thought to myself, my God, they must not have a rat problem with all the cats that they have, just stray cats all over the place. It was so interesting to see them. So yeah, you've got to, you plan these trips, you plan these excursions. Big shout out to the Cayman Chamber who hosted this group trip. I think they did a phenomenal job letting us experience a lot of the culture of the country and a lot of these ruins. I mean, they're so fascinating to see how people thousands of years ago were able to build these massive structures. I mean, these are engineering feats when you think about it, even by today's standards, right? The Acropolis and these Colosseums and stuff. It's like, wow, the manpower that it would have taken to put these together is just absolutely amazing. And then it saddens me to hear how the English and other cultures, but primarily the English, came and pillaged in the name of, oh, we'll do the excavation for you, came and pillaged these countries and took a lot of their original pieces and artifacts away from Greece. And they're now in the English museums and they don't want to return them. My God, it's just unbelievable. But it's, again, what has happened. So look at this. Look at the Acropolis. Isn't this amazing? And the acoustics on like the theaters, where you can like sit in anywhere in the theater and hear, no matter where you're sitting as the audience member, without any amplification. They didn't have any fancy microphones back then. You could hear the people performing in the theater. Just speaks to the amazing ability to design, structures that were just acoustically almost perfect. And so down here, they have people perform concerts and stuff still to this day in this ancient area. And then everybody can go there and listen to outdoor concerts and enjoy these. So it was just absolutely fascinating. Lots of, very interesting architectural structures and stuff that we quite enjoyed. So, when you go on vacation, folks, get out of your comfort zone, do something different, see something different. Even going to Miami, there have been times when I have said, you know what? I've never been to the Everglades. Let me go and check out the Everglades. And of course, we know that there's a lot of them. Here's another salad. This was probably the first meal at the restaurant. So this was typical of what I would eat. Lots of salad. And like I said, it's a good thing I love me a salad, Jill. But this is the actual hotel as well. So it was very interesting with the mountains in the background. So yes, there was, what was I just saying? Oh yeah. I go to Miami and I'm like, okay, let me go to the Everglades. Let me see the Miccosukee, whatever Indians, because they were the originals that were there. So you have to seek out culture. Otherwise you just end up in a mall. Culture doesn't always come to you. You have to go to it. And so, I've done more than one of the Everglades trips, going to like the actual, the Seminoles is a big group in Florida, a big Indian group. Of course, what's the Seminole culture? Casinos? That's not their culture. That's what they've had to do after the Europeans and everybody else came and stripped them of everything and left them with nothing but alcoholism and child abuse and molestation. They try to now give them a little something back and, we'll give you a casino. We'll make you gamblers then, as though that's going to somehow really, really help their plight. Good Lord. Anyway, the airports, again, interesting. We had to, by the way, we had to walk. You would have had to walk a long distance, but they actually had buses at the Athens airport that took us to the plane, that actually bused us to the plane, because they don't have, it's not fancy like Miami, where they have the, what do you call the connector piece where it like connects directly to the plane. So there were certain airlines that seemed to have the privilege. So Emirates had that privilege when we got off of Emirates. But then a lot of the other, including the national airlines, didn't have that. You literally walked up the steps just like we do with Cayman Airways. So that was kind of interesting. This was business class, which we were not in, but just showing you the luxury chair of the business class section here. And on Emirates airline, comfy seats. You had a little bit more privacy. You weren't on top of each other. Like I said, big shout out to Cayman Airways, because I really missed having a little bit more leg room. But nonetheless, the experience, the takeaway is that it was still a good trip. I learned a lot, and I appreciate a bit more now about Greece and about what they have to offer. So I had great Italian food in Greece, which is so weird. Yes, honey chill. All right. So that's that. Good morning. Marcia says third world and ghetto. That's what it looks like. Well, unfortunately, the graffiti and even the derelict buildings and stuff really do kind of give you that impression. Like you can see they've obviously had some tough economic times that they've never really fully recovered from. And no one is trying to like spruce up these buildings or make it look pretty and nice. And again, it's interesting for me because for the most part, when you look around Cayman, although we do have some derelict vehicles, they tend to primarily be in like residential areas. And so it's residential areas where people are not finishing their homes and stuff that make the whole neighborhood look horrible. The commercial areas are pretty well maintained and pretty well kept. So Nat B says graffiti's all over Europe, go to France and Germany, and it's everywhere. Wow. That's why I got to travel, honey child, so I can see it for myself. Miss Barbara says to drink a straw when drinking your water. I was a Pepsi-holic until I started using a straw. I no longer crave any drinks except water. Yes, child, I got more than enough straws. And I use plastic straws because I'm trying to be environmentally sustainable and friendly. So I have my little plastic reusable straws, and I guess it helps a little bit, child. I don't know. Soka says, I love containers also. Have you ever been to the Container Store? Yes, girl. Are they still around though? The only one in Miami I can find is down by, and I don't go on that side of Miami that often, all the way down, is that Dadeland? I think that's Dadeland Mall, where you have the falls and stuff like that. I don't hardly go in that area, but I remember a huge Container Store being there. Is it still there? Soka says, I love graffiti art. Markings, no. Well, I wouldn't have called it art. Garrett says, Greece is one of the poorest countries in the EU. Oh, yes, their money was interesting. First time handling the European money. And so I actually came back with money because I didn't really buy a whole lot, but I came back with cash. It was interesting. Yeah. Natasha says the white color dates back to the cholera outbreak, and they had to whitewash the buildings with limestone, which was a disinfectant. Today, all new houses must be painted white. Thank you for that bit of history, Natasha. Aliana says, how was the economic atmosphere there? Did it feel live and active? Because Greece got hit hard financially a couple years ago. It was, and Rough Seas says, didn't Greece go through a major riot about 8 years ago with the immigrants? So it was, I mean, you still get the sense that obviously there are economic struggles. Like, I don't know exactly how bad it is, but you know, it's hard to measure these things as a tourist. And this is one of the things that I was even saying about William. You go there for a week. I can't say that I'm an expert in Greece. By no stretch of the imagination. And it's hard to know how the average person lives, right? So we didn't go into anybody's homes or anything like that. So I don't know. I can't really say. You know, Athens has like 4 million people. So of course you saw a lot of people and a lot of activity and whatever. But, you know, it was difficult to see. The cars are very, very small. Obviously, the roads are small. I can't speak to, you know, the economic activity. I mean, I had a few dollars and I went in shops. You know, they were all just like in Cayman. You go into the touristy area in Georgetown, everybody pretty much has the same thing, the same little bags, the same little trinkets, you know, the same kind of t-shirt ideas. You know, not a whole lot of uniqueness, to be honest, in terms of that. And that's to be expected, I think, for those particular areas. I don't know. I don't know much more about, I can't really answer that question about the economy because I just don't know. Emma, good morning. Europe stole everything from the rest of the world, says Al Ebanks. Good grief. Thank you, Damien. There's the Kissimmee Indians. Yeah, we went and saw the Mississauga tribe, I think. So they have their own little tribe stuff there. But again, there's no Mississauga Indians working there. They're just regular Americans. They probably have 10% Mississauga Indian blood, and they're like, oh, we're Mississauga Indians. You know, there's a whole thing on the Seminole plantations about that, right? Not plantations, good Lord. That might be the more appropriate term. But the Seminole, what do they call them? They're grounds. So you get paid, and this is something that it's so sad because it's actually been detrimental to the Indian people. But if you're 100% Indian, say they get $4,000 or $5,000 a month from the casino, right? And the money flows. Americans love gambling, so they make a lot of money. If you're 50% Seminole, you get 50% of that, but you have to prove your lineage. So there's been this whole thing, and there's been a fight within the Indian community where people are trying to prove what their lineage is and what tribe they come from and whether or not they're entitled to money. One of the horrible things that it has done, it has created a whole multiple generations now of people who never really had to work. Somebody just handing you $4,000 or $5,000 a month is not a good thing when you're not working for it, right? And so they, have huge alcohol on the reservations. That's what I meant to say, not the plantations, but might as well be a plantation. They have, gambling issues. They have a unbelievably high alcoholism rate, child sexual abuse. I mean, it's just rampant on these reservations. And it's such a sad thing that the corrective behavior to try to repay the Indians by, okay, we'll give you this land. You don't pay any taxes. You don't do this. They get tax free. You can, sell cigarettes. You can do all this kind of stuff, has created an environment, unfortunately, that has been really, really detrimental. They have high suicide rates. They have high mental health issues, lots of depression. I mean, it's just absolutely unbelievable. Like, you took away their ability to be sustainable, and then you tried to give it back, but the way in which it was done is just, set up a casino and do gambling and sell cigarettes and whatever. And it just has not worked in their favor. But I had a girlfriend who worked at the casino. She's an African-American, but she worked there, their finance department. She's like an accountant. And she was like, Sandy, these people make money hand over fist. And I don't know what they're doing with it really to help their community. But, people just come in and collect their check for the month, and they get paid all this money just because, I'm 100% Indian or I'm 50% or, but everybody was trying to claim like, I'm 5%. So I need to get 5% of $5,000 a month. Child, it was a money grab. And there's like big, big discussions and wars, and not like killing wars, but you know what I'm saying? Like internal conflicts and stuff over that whole situation. Rough Seas says, isn't Cayman going through the same? A casino doesn't sound like a half bad idea. Actually, casino, if you were listening to what I just said, is probably a horrible idea. There's certain things that you just do not have to encourage people to do. People gamble anyway. And if you're an addict, and I think it brings out, when you have it so readily available, it certainly brings out the addiction in you. Speaking of that, before I went to Greece, I did a quick trip to Miami. I had to pick up a few things. And so that weekend, the Powerball was on, I don't know how many billions of dollars. So I bought Powerball tickets. You know that I bought lotto tickets. That's been like probably almost a month now. I bought lotto tickets. I've not even scratched off my lotto tickets. I bought some of the scratch off ones, like, win, $10,000 a month for life or whatever. So this is the most I've ever spent on lotto tickets, because I'm not really a gambler by any stretch of the imagination. But I was in Walmart, and they had a machine there, again, making it real easy, where you could buy lotto tickets. And I was like, okay, let me buy the Powerball. And then I bought a couple of scratch off. Honey child, I got to find them. I put them in some folder. I don't even know where. I could be a millionaire right now and not even know it. That's how horrible of a gambler I am. I don't even check to see if I won. So pretty pathetic, but I'll find them and scratch them off one day. See if I won any money, and then I'll let y'all know. But yes, I don't think that quick and fast money by way of gambling and stuff is always the answer. Garrett says many airports do that, even JFK. You can park in the stands and you can take a bus to the terminal. Pasta was from the Chinese, says Damien. Garrett says some stands have jetways and others you take the bus. Athens do have jetways and buses. Yes. So we use the jetways with, like I said, Emirates airline to deplane and to get back on. And then there were no jetways for the smaller airlines. Debbie says travel is important. It puts things in perspective. It sure does. So the Container Store, I'm told, is still there. I actually have not been. There's one in Avatura as well. Oh, You know, I've not been to Aventura Mall in years, and I haven't been to Dadeland. I was never really a big, like, that area of Miami anyway. I haven't been there in a really, really long time. But you know what could convince me to go is food. Now, here's a question for those of you familiar with Miami. So, Nick, listen carefully. Is the Hops restaurant still in Dadeland? Remember, it was down by that Falls Mall or whatever. Is that still there? Because I haven't been there in so many years, and I would go just for their croissants. Honey child, they gave you this appetizer croissant that was like drizzled with some kind of like cream cheese or something. Oh my God. Let me sip my water because that makes me hungry. So good. Hops was a restaurant. There's a few of them around Florida. I remember one in Tampa where they had like their own brewery, like inside the middle of the restaurant. It was like this huge room where they brew their own beer and whatever. And you could get, that's why it was Hops, like the Hops, you know. And so you've never heard of Hops? What? Are you kidding me? But I think that was the only one that I recall ever seeing in Miami was down by the falls. So, oh my God, whatever happened to Sweet Tomatoes? Was it called Sweet Tomatoes? That was like a salad restaurant. I used to love when I was in university. I loved that restaurant. And then I think they've all disappeared. But anyway, wow, they probably don't even exist in Miami anymore. I don't know if they're still around. Good morning, Miss Ethel. Says she's been under the weather. Thank God for my recovery. Good to hear that you're feeling better. Leroy says cash pot is addictive. I don't even know what cash pot is. Is that the tickets? Oh, the tickets expire? Really? So I better hurry up and rub them off and see if I won anything. Garrett says you're the worst gambler I ever heard of. I'm telling y'all, do they expire after 60 days? Oh my gosh, I better hurry up and check and see, yeah. Okay, well, I'm gonna scratch them off later on then, see if I won anything. Yeah, I am really not a gambler. I'm like, listen, all I know in life is hard work. I've not had the fortune of ever just be like, here, we're gonna just give you this in life. Whew, honey child, I wouldn't know what to do with it. Gabby says, I think you have up to a year to claim your winnings if you won, but I guess I got to scratch off those tickets. Aw, Sweet Tomatoes closed during COVID. Best vegetable soup ever. Miss them. I haven't seen them even way before that, but I used to love Sweet Tomatoes. Hello, KK. You're here late. Better late than never. Somebody else says, yes, Sweet Tomatoes has definitely closed down, sadly. So, you know, all the Boston markets are just about gone as well. I found one, not this trip, but the trip before. And I kind of was eating it with nostalgia on my lips, thinking this is the last of it now. You know, the Boston markets. I love their Parmesan chicken. I'm like, well, the Boston markets, folks, gone. That's it. What can you do? Food in Thailand was amazing, says Debbie. Yeah, and you know, like I said, the best restaurant that we went to, and it got better, I feel like, once we got out of the hotel. And this is what I'm telling y'all, hotels or whatever, they're an experience, right? But you got to get out. And so when we did go out to some additional restaurants kind of on our own, like we started to seek out and find stuff, there was an improvement. Lots of seafood on the islands, obviously, lots of like calamari and, you know, all this kind of stuff. But the best restaurant was that Italian restaurant. And I'll tell you what, this tiramisu, I'm going to show it just because it's a food memory now. This is the best. We went 2 nights in a row to this restaurant because I enjoyed it so much. I was like, oh, I need real food. Forget the hotel food. But this tiramisu is the best tiramisu. And y'all know I love me some dessert. And I'm like a connoisseur of tiramisu. And what's the other one that I like a lot? The sticky toffee. So everywhere I go and I see tiramisu or sticky toffee in the menu, I'm like, let me try it and see how good it is. But this tiramisu was the best tiramisu I have ever had. Here it is. In my entire life. Yeah, they had like the little biscuits on the side like that. And on the bottom was actually a layer of like chocolate cake. But it was, food memories. Listen to me. The best tiramisu ever. Nobody has, listen, They got good tiramisu at Casanova's and whatever. But this, and the thing is, it wasn't super sweet, it just hit the spot. Maybe because I was so desperate for good food. But the music, I love that they had street performers. So here's one street performer video. It was so nice to see people performing. This is another guy. So I must say that I don't know how much you guys pay attention to sounds when you go to certain cities, but I take in the sounds as well as the sights. And, some sounds to me, some places are just noise. And I have actually traveled before, like if I go to Havana, for example, I find it very difficult to sleep at night because I'm used to the quiet of Cayman. At night, there's like no sounds. You're inside your house, it's like dead quiet. Elsewhere, windows are partially open because there's like no air conditioning. You've got bars up on the windows and things are open, but you get a lot of the street sounds. And it's just different. And if you're not used to that, it can impact your ability to get a good night's sleep. So I find like Kingston, Havana, these countries, cities, larger cities are obviously very, very busy with sounds and stuff. And so it's a different kind of environment and your brain has to get used to it. But I love to hear street music. I love to hear the sounds of like the ringing of the bells at the church, right? The sounds of a place also to me is like something that makes a difference in how you feel about the environment as well. Morning to Ingrid. Rough Sea says any addict can go broke from something. It doesn't have to be gambling. No, but I think that gambling is a real addiction. And, there's a lot of people here that suffer from it. And there's a lot of people here who've gotten themselves in trouble because of being addicted to even the numbers game here. There's a lady worked at Turtle Farm. Her case, I don't think she's been found guilty yet, but her case is coming out where she's alleged to have stolen a substantial amount of money from Turtle Farm. Has nothing to show for it because what she was doing with the money was just gambling it away because she's a gambler. And people like every single day, this woman is going out there purchasing, all these numbers. Like the number of people come see her 2-3 times a day. If you need to go buy numbers 2-3 times a day, you have an addiction. And, we don't even have, do we have Addiction Anonymous or whatever here? Is there any help for addicts? We're not thinking about any of these things, but yet y'all want to jump up and have gambling legalized. And I'm like, okay, make sure you also have the ancillary services for people who are addicts. Soka says there's still a Boston Market on Hollywood Boulevard, one further out where it turns into Pine. I'll see if I can find it the next time I go to Miami. I need to get the exact address though, because don't try calling them because they can't tell you who's open. Rough Sea said, I'd rather go broke from gambling than broke from crack. At least I could come back from gambling. I'm not sure that those addictions are worth comparing, but an addiction is an addiction. So I don't know. KK says, I want to travel the world, but food testing, I'm scared of. I can't try new food. Try it. Most of it is not going to kill you. I mean, the salads were good for me. And, you lose a few pounds while you're on vacation. There's no harm in it. The only way you're going to know, and the only way that you're going to appreciate how amazing this little rock is, even in terms of our food. I have always said this, that Cayman has some of the best restaurants in the world. The food options that we have here for such a small island and small sets of island is amazing. You can get good Italian food here, Caribbean restaurants, American cuisine. Do we have a good Greek restaurant here? I was trying to think about this. I don't know if we do, but I mean, there's a lot of variety here. You can get a lot of fresh stuff. I mean, I think the food quality in Cayman is one of the best, if not the best, that I've ever seen anywhere in the world. And having lived in the States and, gone to some amazing buffets all over, I think that Cayman is just phenomenal when it comes to our food. Papagallo's on a Sunday. Have you been there for their brunch spread? Oh my God, it's like, a foodie's dream. Good morning, Miss Edith, joining us from Rotan, Honduras. How are you? KK's laughing. Y'all know I love me some food. Garrett says the Cayman Islands is the culinary capital of the region. Well, I saw recently that somebody else stole that title from us. They won, I think it was Jamaica, actually. Didn't Jamaica win some culinary title? I was like, how the heck did Jamaica beat Cayman? But you know what? Jamaica has a lot of fantastic food as well, both local and other cuisine. I mean, they've got a lot of professionally trained chefs there, right? So I think I saw, what's her name, put up a story where Renee, where they had won some sort of culinary. Hold on now. I think they named the culinary for the region. Restaurant month. You got today and tomorrow left. So folks, go out and enjoy restaurant month. I'm going to see if I can go to one or two restaurants. I think was it Jamaica that just got the coveted title for the culinary whatever of the region? Some regional thing that they won. But anyway, I'm gonna still defend Cayman and say that Cayman is the best. Okay, let's move on. Yeah, they won some culinary award. I can't remember exactly what it was now, but congratulations to them. All right, Damien says yes, they won something. I remember seeing something in the news. Damien says, who said Cayman didn't? Cayman is the culinary pearl of the Caribbean. The only issue is we don't have Caymanians in the industry. Well, we have some, perhaps, more. And again, Caymanians, y'all need to step up to the plate. And, if you want to be part of that, then, do it. So I'm going to tell y'all about a little bit about a new business venture that's going to get me into tourism more than I ever thought I would be. So at the moment, I'm studying, I'm learning. That's all I'm going to say for now. I'm immersing myself in learning all about Cayman's tourism product. I'm reading stuff online. I'm signing up for stuff that DOT has available that's free to help you market your tourism businesses. Y'all need to educate yourself about what's out there and what's available. So big shout out to the Department of Tourism. Okay. Yeah. So last week on Friday, we obviously, had a live show on Friday. We talked about a couple of things. And one of the things that I briefly discussed that I want to touch on again, but I'm not going to go into too much details on it because I'm conscious of who the victims are. This is a child molestation case. I'm conscious that there's probably, in all likelihood, multiple victims from this one perpetrator. And he's a disgusting POS. And he, I suppose, will have his day in court once he is formally charged. They need to put him underneath the jail and never let him out again, from what the streets are saying. This man seems to have been prolific in his abuse of multiple people. Yes. It's horrible. But someone said to me the other day that let me read this because I don't even know how else to say this or how to explain this. But this person actually worked at one of our local schools. Now, that is so much more disturbing, knowing that he was molesting children and he worked at a local school. He said to someone who worked there, listen to this. This is what they said to me on Friday's show, but I didn't get to read this comment. They say, talking about abuse as a child, we talk about the guy from East End who was arrested for child sexual abuse. He's an employee for government. I don't want to say which department. And he also worked at Clifton Hunter. He's been suspended from work. Thank you, CIG, for doing so. And, you know, he was at the school some time ago making comments about how a particular young lady was a lesbian, but he didn't condone it because it's against the Bible and blah, blah, blah. Just goes to show how the biggest Bible thumpers have skeletons in their own closet. Well, first of all, being a child molester isn't a skeleton in your closet. That is a sickness beyond, right? And this is what a lot of these child molesters do. They hyper focus on the Bible, the elements that they think make sense to them, right? So they're anti, this person is a lesbian and I can't support that because the Bible speaks out about that. Well, you think the Bible would be condoning you being a child molester and raping and molesting numerous young girls? Really? You worried about some young lady being a lesbian? That would be the least of your concerns. And in fact, she might be a lesbian because you actually molested her. How about that? It's like these child molesters walk around this island with some level of what they think is just immunity. Like they can do and say whatever. Oh my God. KK says, I don't know why he's on bail. This isn't the first. Well, everybody's talking about it. And this is my question. I don't know this man from the Man in the Moon. I obviously now know who he is and who he's connected to and where he works and whatever. If people knew this was at the first and people seem to know that he's that type of person, why did it take so long? Why is he now just arrested because somebody had to walk in on him literally molesting a young child? How long was he going to be permitted to go? The man is in his 50s. And I understand he's probably been doing this his entire life, even molesting other family members that he would have grown up with. Seriously? Caymanians, we need to stop placating and stop playing around with these individuals. And we need to speak up. We need to call the police. Mothers, when your children, your young girls and boys come to you and say that someone is touching them and they're molesting them, you have got to stop this foolishness of trying to protect your family name, because all you're doing is protecting the perpetrators. Expose them for who they are. Right now, there's another young man, and he's pretty young, so he's got a whole lifetime ahead of him of molesting other people. And because the family, oh no, we don't, oh, family name, your family name means nothing if you do not stop perpetrators. If you let these men have access to your children, I don't care who they are, fathers, uncles, cousins, whatever, and you sit back and do nothing because you're more concerned about your family name, nobody in that business with your family name, and everybody in the community who knows what happens is looking at you thinking, why aren't you protecting your children? That's the only question. I don't care what last name you have. Your family name carries nothing if you have child molesters attached to it, as far as I'm concerned. I'd be ashamed. I would change my name to my family name. So, you know, how is it that we're allowing these perpetrators to walk around with such impunity? Like they don't even care. You know, you can imagine this man having the audacity. Oh, she's a lesbian. And then the Bible says, I mean, I would take that Bible and beat you over the head with it if I could right now, sir. That's what you deserve, no less and much more. Really? Everybody's like, well, you know, Sandy, I'm not surprised because he always gave me those vibes. And yes, you know, he went and slept with his son's very young girlfriend. Like, who does that? Everybody, nobody that I have met has said, wow, I'm surprised that this guy, what, him? Everybody's like, he's icky. He's that kind of person. I'm like, what the, and y'all haven't been speaking out? No, sir. Just like the Stevenson guy that's married to our track star, still having access to our athletes, right? Atto Stevens, when he was convicted, I had big hardback man was Sandy, you know. Yeah, boy. I used to watch him when he was talking to them little girls. I didn't play field time, but he coaching them and rubbing their leg and stuff and going all the way up their thigh. And I was kind of wondering what was going on. What do you mean you were kind of wondering? Why don't y'all speak up? If I see something that makes me uncomfortable with children, especially, I don't care whose child it is, I'm going to be like, why is that coach touching these young girls like this? Oh, physiotherapy. No, make a female do that. You know, he's practically touching their privates. You see these situations with coaches and gymnastic coaches, and, you know, they have access to these young girls and they're unfortunately taking advantage of it. No, sir. Oh, my God. My goodness. Suspended with pay, says KK. Yeah. I mean, they have to go through the process, right? So government can't assume his guilt until he's actually proven so in a court of law. Garrett says they're anti-whatever is not themselves. Damon says, does this guy have a background record from where he came from? Where he came from? You mean in East End? Does he have a background record in East End? Damien, he is a Caymanian bred and born in multi-generational hardcore East Ender. We don't have to look at any foreign nationals to talk about where they come from. Unfortunately, we have our own that are child molesters, that are abusers right here in this jurisdiction. So what record he can have? Molesting his own sisters? I mean, that's been alleged now. They were like, oh yeah, I always heard he was molesting his sisters from like 30 years ago. I said, really? And y'all did nothing about it. And then a woman can go and have a pile of children with him and just leave her children with this man? Y'all need your head checked. KK says, I'm sure if government dig deep, he wouldn't have that job today. What a mess. Johan showing up late. Good morning, Johan. KK says, when your child speaks, listen, I'm sorry, these parents are gross. Well, again, you know, the fact that a child can come and tell you that something has happened to them and you not believe them, to me is so incredibly egregious. I watched this YouTube channel called Unfiltered Stories, and it's about people who unfortunately have gone through child sexual abuse. And I tell you what, it happens. I mean, when I watch those, it makes me know how unsafe the world is. And anybody, older brothers, cousins, I mean, you can't trust anybody with your children, folks. You've always got to be hyper vigilant. And so there was one story I was watching over the weekend with this young lady. She's now a professional and she, you know, offers therapy and stuff to other victims. She was talking about how she was sexually molested for like 3 years by her brother. Now, this was back in like the 70s, 80s. You know, things have changed a lot since then, but in many respects, they haven't changed. And she said that, you know, when she didn't tell anybody in her home, but she was playing with her friends and they were playing some game. And it was like boyfriend, girlfriend kind of thing. It's like, oh, you have to take your clothes off, whatever. And she's like, oh, my brother does that to me all the time. He's always touching me. One of the kids who heard her say that obviously knew even then that didn't sound right. She went and told her parent. Her parent then went to this child's father and said, your child blurted out as a young child that she's being touched and basically molested by her own brother. And so the father came to her and said, is this true? And she said, yes. She said no one ever talked to her about it. Just one day, the brother, who was a bit older than her, I think he's about 10 years older than her, left the household, the family home, and that was it. And he was gone for a number of years. She said he then came back. Listen to this craziness. He then came back into the family home. He tried it again, but she was old enough now where she said, I'm going to tell if you ever touch me again. So he stopped. But of course, she's like, I never felt safe. I felt like nobody valued my safety. Why is he back in this household? But the worst thing is no one talked about it. No one in the family said this shouldn't happen to you. We've got to get you therapy. We've got, so it's so unbelievable that people could have something like this happen to a child. The child is already confused and doesn't understand stuff. Why didn't you have a discussion with the child? Caller, good morning. Hello, caller.
Hello.
Morning.
Yes, Sandy.
Yes, dear.
Good morning. Well, I'm glad that you're back.
Thank you so much.
Yeah, I was listening. This is off subject about pedophiles and rapists and whatever. But one of the best trips that I've ever been on was Spain. It was put on by a company out of Toronto, Happy Tours. And if you ever get a chance to go to Spain, the only thing that I didn't like about it at the time, they keep giving me this glass of wine and telling me how to sniff it and whatever. I said, give me a good Bacardi and Coke.
Yes.
Yeah. Anyway, it is sad about the way Cayman has gone now, and nobody wanted to talk about it. Only recently that it has come to where people are coming out of the closet and saying, "Listen, I have been molested," and I think you should get part of the credit for that, for being so vocal about it. On the weight loss thing, my son, he had a weight problem. He was weighing 540 or 550 pounds, and Sandy. And he went on a program after he had an 8 or 9 hours operation for a hernia, and he realized how close to death he came.
Wow.
He went on a program on his own, and he's now down to 260 from almost 550 pounds.
Wow. That's amazing.
And he says he wants to use that as to help other people. So I told him once he accomplished his goal, he wants to get down to about 235. And he said the only setback that he's having is when he looks in the mirror and he sees all this skin. I said, what are you worried about? What are you thinking of negative about? Use that skin as an inspiration and motivate you to not go back there. Just hang up the clothes that you had on the wall in your living room, right over the TV, because you're watching TV all the time, and use them to motivate yourself never to go back to where you're at. But it took a lot. I'm so proud of him because he has the discipline. He goes to the gym. He got 24-hour gym thing done by Commander Bay, and he does a lot of. He goes to the gym, and he is happy with his life now. I see him smiling. I didn't see him before.
Oh wow!
It's maybe when he accomplished his goal. Now he says that it was like about almost 2 years that he's been in this program, but he didn't go by any books or anything. He decided to study up on what would be the best thing that can, eating. And he's so happy with himself. So when he accomplished his goal, what I'm going to do, I'm going to have him, I know he won't be talking to me after this because he is a very private person. And I'll have him probably come on your show, and so that maybe he can, help other people. But if you see him now, he looked like a wild man when he was morbid, obese. And now looking at him now, he's a complete different person.
Wow. Congratulations, my dear. Thank you so much for that.
Oh, okay, Sandy. You take care and
I appreciate it.
Work.
Thank you.
Okay. All right. Bye.
All right, my dear. Bye-bye. Yeah, that's amazing. I mean, I love to hear those stories. We all struggle with something. And so I think that you share your struggles, you share your your victories, you share your failures even, with people. And I mean, that's how we kind of get in a better space. Let me see here. For the test results. Okay. Fridays. 1 second, sorry. Mm-hmm. Mm-hmm. Okay. Yeah, so mm-hmm. Mm-hmm. So thank you again, Mr. Dexter, for sharing that. And we wish your son continued success with his weight loss journey for sure. Makes the world a difference. I mean, listen, we all know carrying around a little extra weight just makes you even feel different. So someone says in the WhatsApp comment section, good morning, Sandra. The bad part is his wife knew what he was doing, that he was doing it, but she would go out and grind every man on the island, honey child. Heard he had a child by his sister. Oh my God. What the hell? So sad. This person says, good morning. When I was a little girl, around 7 or 8, I used to sleep over at my friend's house and always wake up wet. But I only was wet in the bed. When I was by her house, I couldn't understand. One night I woke up in the middle of the night and there was my friend's brother between my legs playing with me. When I woke up, he said, go to sleep, you're dreaming. I never understood until I got older what he was doing, and I never went back after that. He was way older. Wow. Wow. Unbelievable, but not surprising. It's one of the reasons why I tell parents never, ever in a million years allow your children to do sleepovers. I don't even want anybody sleeping over to my house. It's not going to go in either direction because some parents are like, well, I don't trust nobody. And then you want people to sleep. No. I don't want the responsibility. I don't want any mix up. I don't want any confusion. No, and no. Okay? You sleep at your house. My child will sleep at her house. They can meet for play dates when it comes a particular time of the evening. It's getting close to bedtime. Y'all say goodbye. You come to your room. You sleep in your own house. You know what's so horrible? Thank you, listener to the program, for sharing that story. There have been children who've actually been abused, raped when they were sleeping because they're very, very sound sleepers. They don't even know. Can you believe it? Like she said, she was waking up with physical symptoms, but didn't know what was causing it. This is real, folks. This is what's happening. So it's not always that, the father in the household, it's other people. And you don't know who. I've heard of stories where, okay, there's no men in the household. Oh, but somebody comes over that night. They had a little social. They didn't leave. And then in the middle of the night, they out molesting your child. Don't allow no sleepovers. You don't know what's happening in other people's homes. And it is your business as a parent to be hyper vigilant and to know what is going on in your own household. Talk to your children. I cannot stress this enough. And one of the things I absolutely dislike and I hate with a passion is when people don't recognize, because then people say, oh, Sandy, you're being too. I'm like, listen, call me crazy, call me overprotective. I don't care what you want to call me. I will do everything to protect my child. Okay? When people are like, oh, I want to tell you a secret. And they tell your kids, don't tell your mommy that Listen, there are no secrets from me. I tell my child this all the time, even on Saturday. It was like, a family member said it jokingly to her. And I said, no, 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 no. There are no secrets. Never get ingrained in your child's head that anybody can tell them something that they can't come and tell you as a mother or good fathers, right? Because if you tell your kids it's okay to hold secrets and to keep secrets, there are perpetrators out there who use that same thinking. Oh, this is our little secret. But if your children understand that there's no secret from my mom, I tell her everything, they will open up and tell you. The door is there for you to have conversations about what makes them uncomfortable. And you have to take advantage of that. Someone's asking for Mr. Dexter's number. Oh, hold on one second. Let me have a look here. There you go. Okay. Someone's sending a voice note. That's probably not for the show. All right. So, folks, I mean, I know y'all might be getting sick and tired of me saying the same thing over and over again, but trust me, I will preach the same message until the cows come home, because we have to do everything in our power to try to protect our children. And we protect our children by making sure that we're educated, that we know what's going on. I mean, I can't imagine that a mother could be told that somebody's molesting your child, and I don't care who it is, and you're more concerned about living your partying life or whatever, and you don't even believe your own child, you don't do anything about it. Now, I understand the mother's now having issues of her own. She's lost her government job. She's out there in drugs, whatever. So now she's probably not in much of a capacity to help. But, the allegation is that this man has molested more than one child over the years. And so now the latest victims, all of this could have been prevented had he been arrested, charged, and put in prison before. Now, all the children have been removed from the home. He should have no access, even as this investigation is ongoing, right? This is where I have an issue with the system. He should have no access to children. Okay, he's been suspended from work, so thank God he's not going to be at Clifton Hunter. But y'all probably even need to talk to some of those kids. Like, you don't know the true magnitude of how many children over the years this man has actually molested. Johan says, slew them, Sandy. They're monsters, and those that protect them are a big part of the problem. Johan goes on to say, one day these sick people are going to mess with the wrong person's child, and it won't go the way people think. It'll be violent, ugly, and all about street justice. Why can't I see all the comments, or did I touch something? Oh, I don't know. We're seeing you, Johan. Soka says that he's probably never even been off of Cayman. I don't know. Perla says, are these male coaches supposed to train boys and girls? Or has that stopped too? Does it matter what kind of person trains these individuals? I don't think it should be males with girls and females with boys. Well, really and truly, folks, there are male coaches that are professional and would never think of doing anything inappropriate with your children. You can't go off of like opposite sex, because remember the male teacher, drama teacher that happened to have liked little boys and was encouraging them to send him stuff? That was one that we unfortunately imported in. So don't put on these, what I would say, like blinders to think that your child is safe just because it's a female child with a female. You've got to be vigilant, and there's certain behaviors and certain things and certain protocols that should be put in place for all coaches. So no coach should be dealing with children single-handedly by him or herself. You need to have another person there at all times, right? Your child should not be isolated with these individuals. Coaches, teachers, adults should not be using social media or WhatsApp conversations or anything like that to have private conversations with your children and to be able to communicate and chat with your children. That also should not be allowed, because we saw a lot of grooming that was happening, with these children, where these coaches were over time buttering them up, grooming them, And when a child's of a particular age, they don't even understand or know that they are being groomed. They think, oh, this person's just being nice to them. And it's not just coaches, church leaders, teachers, family members, anyone who you see has an interest in a young child or someone younger than them, even older cousins. I hate to say it, but when there's a particular age gap between cousins and that cousin always wants to hang out with younger cousins, ask yourself why. What does a 15-year-old have in common with a 6 or 7-year-old cousin? Someone, 10 years or even 5 years, even a couple years older or younger than them. They should be hanging out with people more appropriate in age who are interested in doing the little things that they're interested in doing. Because I hate to tell you, but one of the wide areas of abuse, and I've heard numbers of up to 40-something%, is from teenagers, other people who are just a little bit older than your child. And so you've got to be hyper vigilant with these kids. Right? Oh, just send them over to their cousin's place. They're in the basement playing with the cousin, or we don't have basements in Cayman, but y'all know, in the house outside playing cousin. No. Under no circumstances. You see, I'm that parent that I'm going to be there. Oh, y'all want to go sit down in another room and talk? Okay, I'm here. What are we talking about? What game are we playing? Be that parent. Right? People can call you a helicopter parent all they want, but you will protect your children from a lot of evil that's happening in this world. And a lot of it is coming from teens and family members who are just a little bit older than them, who are going through sexual explorations of their own at 12, 13, 14, 16, whatever, and they're taking it out on your little ones. Don't let them do it. Inspiring, good morning. Says sexual victims often don't speak about it because of fear of victim blaming. Absolutely. And we see that a lot here in Cayman. This is why we need education more than ever. They may also fear being shunned by their loved ones and community. And additionally, they fear retaliation or punishment from their perpetrator. Thank you, Inspiring, for sharing that. And in fact, let me say this. We had a case, I think it was last week, where the verdict came back not guilty. And I want to talk about this because the victim is someone who had reached out to me, their family members and them before the case went to trial. And this person has said that they're fearful of ever returning to the Cayman Islands. This is the guy, the tattoo artist, the Cuban tattoo artist that has been accused. And unfortunately, the jury found him not guilty of raping this young lady. Now, I wasn't here to be able to go to the trial and listen to it myself, but what I will say is this: jury trials can be and I've said this before, very, very unpredictable. And really, it's for the prosecution to prove their case, right? So just because someone has been found not guilty does not mean that they didn't do it. I mean, this sounds like common sense, but it's worth repeating. Because someone has been found not guilty does not mean that they did not do it. It just means the prosecution didn't prove the case. And there could be tons of reasons why. Sometimes the prosecution, in my opinion, has actually proven the case, right? And the jury didn't like the victim, didn't like how they came across. There can be so many factors why a jury will let a person walk. Well, I don't know. The jury is made up mostly of women who have this attitude, well, maybe she was asking for it. Or maybe this was a consensual situation. Like, I don't know. Listen, it's hard, very, very difficult to predict. And it's one of the things why I can see why in the judiciary, there are people who want to do away with the jury system because it is flawed at a number of different levels. There are jurors who don't even want to be there. Let's be honest. They just want to rush through a verdict. They're like, I don't care. I don't want to be here. I didn't want to hear this case. I don't want anything to do with this. I've seen jurors, and I'm sitting there looking at them, who are confused. They don't understand the assignment, none at all. And I'm like, oh man, this person's going to walk. Or they're going to have a hung jury. right? The evidence that's being put before them, they don't have the level of sophistication. I don't want to use that word because maybe that sounds bad, like, oh, they're not sophisticated, but you know what I mean? They just don't have the level of understanding to appreciate what is actually being said. And so they say, well, we're not going to send this guy to jail if we're not really too sure. And there is a measure of beyond a reasonable doubt. We're going to just let him walk. I believe in my heart of hearts that this man is guilty as sin. The biggest reason why I believe it is that I don't know this victim personally, but there are too many other people. And this is the same thing now with the child molester. Too many people coming forward saying, oh, well, you know, yep, this story has followed him for all these years. And yep, molested his sisters. And yep, did this. There's too much chatter around that person's behavior in that regard for me to not believe all these different women from all these different walks of life. We're to believe that randomly people are just going to go accusing this really nice guy. Like those of you who know him, like, oh, he's cool, he's a nice guy, blah, blah, blah. Yeah, if he's all of that, yes, why would anybody and multiple women have a bone to pick with him? It's not logical. It makes zero sense. Yeah, women don't just go around randomly hating on guys just because. And I've heard the stories about him from complete strangers, people who do not know him at all, who were, meeting with him for a business situation, who then said, oh, Sandy, this guy did this. If you can sit down with a stranger, let me put it this way. We're all adults here, okay? If you can sit down with a total stranger and start to, someone you just met 2 minutes before, start to rub up on your man parts and start to, arouse yourself with someone who's there for a business meeting and you don't know this person from nowhere. If you can do that kind of stuff to a woman that you just met in your house or your place of business, where other people are one room over and your girlfriend and maybe a young child is in the next room, you are a predator to the max. There is something wrong with you. You do not do that. That's not normal behavior. And that demonstrates, in my mind, and from what I know from what the experts have said, someone who will equally take advantage of you if they get the opportunity. And that is what this man has done. People have come forward. Oh, I met him for a business meeting and then he was there, rubbing himself and getting aroused and like doing stuff in front of me. And I'm like, what WTF? Huh? And you don't think he had raped somebody? Well, he was freed by a jury. They found him not guilty. So there you have it. The other thing that is concerning is this same guy had a Caymanian ex, because he seems to really want to stay in the Cayman Islands, who fired him. And in her letter as to why she fired him, she makes mention of yet another person who has come forward and made an allegation against him. Once again, nobody took it to the police. Nobody did anything about it. And this allowed him to continue, allegedly, this inappropriate at best and criminal behavior at worst against women. He's a great tattoo artist. He's an artist. He's a cool guy. No one, all these random women are not going to have a reason to just be trying to pick on this guy. I'm telling you, it just does not make any sense. Y'all remember the letter that we shared? Trying to see if I can even find it here now. But he has a termination letter from his own wife, who owned the tattoo company at the time, saying, I'm terminating you because there have been accusations of sexual assault. So now this man is free to walk around our country, free to, continue to remain here on a work permit. You probably soon have that anchor baby or whatever the situation is. And free to continue this behavior. Because the one thing I know about people like this is they can't change. They can't help who they are. So he might do a better job of hiding it. Maybe the next victim, he's going to make sure that this time she's actually, not able to help herself. She's incapacitated in some way. He'll get better at doing what he does. But that doesn't mean that he's going to stop. Like Johan said, he can do it to the wrong person. And then when the wrong person do something to him, then y'all gonna want, oh, well, we gotta take them to court and send a message that you can't do this to you can't retaliate, blah, blah, blah. And yet the system seems to leave people no choice. I want to make a recommendation to the system, right? When they're talking about certain things in the judiciary, I have sat and I've watched prosecutors, some better than others, handle these sexual cases. And I think that number one, the DPP's office needs to hire people that have the experience, because not every prosecutor can handle a sexual assault case. Okay. So I think that it is imperative that the prosecution seeks out more of these individuals with the relevant case knowledge of how to specifically handle these types of cases. The person who handled this particular case, I don't even know who this person is in the DPP's office. I've never heard of them. Her name is Shauna Kay. Never heard of her. I don't know if she's new. I don't know where she's from. I don't know what her track record is. But there is a lady there, but I think she's on maternity leave, who I've seen handle, she did the Renato case and another one, and she's actually quite good. And as if my memory is not failing me, she actually has quite a bit of experience handling these types of cases where she comes from. So she knows certain things to look for, certain types of behavior, certain patterns. She knows what to point out to the court, to the judges, to the jury. And that is what you need, because these cases are very, very easy to lose, because oftentimes it comes down to one person's word versus another. Right? And that can be a very difficult, like, who are you going to believe? You were not there. Well, I wish this victim, and I do believe that she was victimized, recovery. I mean, I don't know exactly how you recover from this. She's not in the Cayman Islands. She says that she does not want to move back here because she does not feel safe. She says, I'm not an island, so I'm far away from him. I'm honestly scared to come back home. When the verdict came in on the 20th, she says, the verdict came in today. He was found not guilty. I'm in shock. They didn't do a sufficiently good job to even explain to her, because she was thinking the letter from his previous employer, which could be put into evidence to show, he's been accused of this before. And I said, that's not how evidence works. And the prosecution should have taken the time, because they got the letter and they provided it to them. They should have taken the time to explain that this isn't a letter that we can submit in this way. And because it's not directly about the allegations in this specific case, that also presents a problem. Now, what did the wife do with that letter? Did she copy it to immigration? Did she send a copy to immigration so they're aware that at the very least he's had allegations against him of this kind of behavior? The problem, however, let's be very, very frank and honest here. Immigration is going to say, well, we can't do anything about it if he's not been found guilty. We can't send him off the island. So despite having a termination letter that makes certain allegations against you, because, everybody, well, maybe the ex-wife had a bone to pick and she was upset about this. You'll find all the excuses in the world. to excuse and deny the fact that this man could very well be a predator. What solidified it for me is when total strangers who don't know him, they don't know the victim, they don't know all the other parties, when they can come forward and say, Sandy, I had this experience with this man, right? Where he was doing these sexually perverted things in front of me, and I don't know him like that. And I think, who does that? This isn't flirting. This is like outright just being a pervert with a total stranger. Anyway, the jurors had no information in terms of that letter. That wouldn't have been presented to them. And so they set him free, and he's a free man, able now to continue and work in the Cayman Islands. Let me say this to victims. I want y'all to pay very, very close attention to what I'm about to tell you. Even if in a criminal court of law, the jury allows him to walk and he is found not guilty, y'all need to start looking at civil litigation and sue the bejeezers off of these employers. They have culpability, especially as it relates to this person, because the streets have been talking about his behavior, and the world of tattoo artists and tattoo parlors or whatever in Cayman is very, very small. So people are hiring him, knowing full well the chain of allegations that have been following him. The burden of proof in a civil case is not the same in a criminal case. Y'all paying attention? So although he has gotten away with it in a criminal case, what you turn around and do is you sue his employers, vicarious liability it's called, in a civil case and hold them responsible for hiring and keeping someone employed who is allegedly sexually assaulting and harassing other people at work. When y'all start to do this, you will start to send very, very clear messages to employers that you cannot allow certain types of people to work for you, and you do nothing about the behavior that you've heard about in relation to them. When people complain to you, you don't reprimand them, you do nothing. A perfect example of where you can lose a case in a criminal court and win a case in a civil court is the O.J. Simpson case. They were not able to find him responsible in a criminal case for the murder of Nicole Brown Simpson. And what's the other young man's name? My apologies for forgetting his name now, right? But in a civil case, you better believe they found him responsible. That's what you do. And you know who you sue? You don't sue him. You can add him on the lawsuit if you want. You sue the employer. They're the ones who are keeping him here in the Cayman Islands. Gabby says, even though he's walking around, people are going to make his life miserable. No, they're not. No, they're not. I can tell you based on the social media commentary that I have seen, no one is going to be making his life miserable. Everybody is taken up for him. Oh, he not that kind of guy. I know him. He's cool. He's this, he's that. Please. Everybody taken up for him. Nobody is going to make his life miserable. Unfortunately, I hate to tell y'all, but we don't live in a community where we make perpetrators' lives miserable. We reward them. We do the opposite, Gabby. We reward them for bad behavior. As Johan said, they're not buck up on the right person yet, but it's an unfortunate situation that we do it. So his life miserable. He probably get a promotion at work. Next thing you know, he owns his own tattoo parlor. Perla says, when you're a juror, lawyer, and any other party, you must learn how to read body language as well as face expressions If you don't know these things, leave this job to professionals like Sandy. Well, it's not about that really, because a lot of these people can be very good at deceiving others. And, I'm not saying I'm a body language expert, and most people are not. But I think that the prosecution, like I said, they have to do a better job of how they present their cases to begin with. Because if they were able to get it into evidence, right, that this is not the first time that allegations of this nature had been made against this individual, you don't think that little bit of information would have weighed on the jury and they would have gone, how many people are alleging you've done something to them? But this is also why it is important, despite what Inspiring said about victims being afraid, victims, feeling ostracized, they are the ones who will be made to feel horrible in our communities. They're the ones who people are going to make uncomfortable, make their lives miserable, Gabby, if we want to know the truth, right? That's why I'd rather give the benefit of the doubt, if there's a benefit of the doubt to be given, to the victim. And then show me why this person isn't this type of person. Because I know that these perpetrators are so good at being narcissists, and they're so deceptive, and they can fool so many people. But you can't fool all the people all the time. So it's, an unfortunate situation that when we're in a position to say, okay, I'm going to give somebody the benefit of the doubt, most people are giving it to the perpetrators. Oh, because he's cool and he likes to go out drinking with you and your buddies? Yeah, okay. There's a lot of work to be done around this whole area of, when victims do find the courage to come forward, making sure that the court system works to protect them and to really try to bring forward the cases, prepping your victims properly, letting them know what to expect and what not to expect. Because there were things that I said to these victims in terms of how you introduce evidence that they were like, oh, I didn't even know that. And I'm thinking, why wouldn't the prosecution explain this to you? Because they were thinking, oh, this letter could be submitted. This is what they said. And I'm hoping one day this victim will find the courage to actually come on the show and talk about this. But I leave that healing process and the ability to do that entirely up to the victim. She said that it's not right. My parents even talked to them about the letter because they got a copy. And the reason I reported it was to stop this from happening to another person, especially with the industry that he's in. It's so accessible for him to do it again. I just wanted to do the right thing. I hope the jury makes the right decision. So this was before the jury's decision came in. Very, very sad. And again, the parents obviously weren't told that that letter would never be seen by the jurors. That would never see the day of light. The light of day, sorry. So when you hear victims talking about being fearful, talking about prosecutors, his lawyer started asking me. It was hard and it felt like he was attacking me. I had to take a moment. The judge allowed it because I was too emotional. I had a panic attack. But after my testimony was finished, the prosecutor called me and said that I did a great job and she was very proud of me. But of course, when the person's still walking out free, that certainly doesn't bode well. All right. In relation to the other child pedophile, this person says, child molester in East End, this person says his wife so hooked on drugs and ended up in critical care at the hospital where a man beat her up so bad she went into critical condition. Instead of her trying to help the children because she knew he was doing it, she just wanted her way. But I believe that was how she could do what she wanted, but not protecting her children. He likes touching people, but I made sure that he never got too close to me because each time he's touching on the arm, Unbelievable. Disgusting. Wow. Be hyper vigilant, folks. That's the best thing I can tell you. Ms. Vernita says people think the devil is red with horns and a pitchfork. However, I understand he's the most handsome, perfect man the Lord created. Most molesters look good and have good jobs, etc. Well, you can't judge them by the outside, that's for sure. They don't come with a scarlet letter that says M for molester. Damien says it's very simple. Anywhere he wants to work as that profession or in any personal interaction, then boycott. Well, I mean, I don't have a tattoo and I'm not getting a tattoo, but a lot of people still go to him because they say, oh, he does such a good job. Ms. Dorothy says long run, short catch. Gabby says, I don't know him, so I'm not taking up for him. So I not everybody. Yes. No, I appreciate that, Gabby. Perla says, watch Law and Order episodes. I know, child, but they make it easy. Perla says, I'm looking refreshed from my vacation. I appreciate it. Good morning, Magdalene. You can't get on. Where? I see that some of you have said that you're not getting the notifications. I guess because we were on a break. I don't know if Facebook isn't popping up, giving you notifications or what. One of the things you can do, though, is make sure that you sometimes you have to like and unlike or like and follow and unfollow a page to kind of start getting notifications again. I've noticed this as just something that is very peculiar to Facebook. So if you're not getting the notifications, I would recommend that. But child, Facebook is always changing something or another. Like before, it used to show you live. I'm just looking at Facebook now. It'd show up at the top that the entity was live or whatever. I don't even see that. They're always changing something up. So maybe unfollow and refollow, unlike, relike, and you'll start getting notifications. There is actually an area for a page that when you say you like it or you're following it, you can actually set, let me show you this. I'm going to show you this real quick, because this is probably extremely helpful. Give me 1 second here. I'm going to open up my Facebook page. Oops. All right. So, okay. Let me pull it over on this screen. All right. So you go to Facebook. Give me 1 second here. Share screen. Yes. All right. Little tech lesson this beautiful Monday morning. So here you are. This is my personal account. If I go to Cayman Mall Road, says that I like the page. See these 3 little dots right here? Click on this. Right? Like as your page. Oh no, hold on. Where's the settings? I just saw it somewhere else. There's an option. Oh, there it is. So I clicked on the little like thing here, and then it brings it up. And you can select your follow settings. So if you say, can y'all see this? I know it's kind of small. My apologies. Let me increase the text. If you say news feed, choose how you'll see the post on your news feed, default, favorites, or unfollow. If you want to see posts like higher, like a category, you click this one that says favorites. The other thing you do is you can go down here and you can say, choose what types of posts you want to be notified about. So if you want to be notified about morning caller, we're still live on radio. Are you getting on the show? Hello?
Oh, is this Marlowe's number?
Yes, but we're actually live on radio at the moment.
Okay, sorry. I'll call back.
Okay, thanks. So if you notice here, right? Let's just go back. So here you can say notifications, choose what types of posts you want to notify about. If you click videos, this one, video. Then it says all notifications, all video notifications from this page. just highlights, or you can even turn it off. So if I say all, now every time we go live, you should get it. Everybody saw the steps there? Misha, maybe grab this and reshare this as a short so that people can see how to adjust their settings. So for highlight videos, I can say, yes, show me all notifications. Offers for content, there's like highlight standards. So they'll show you up to 5 new posts notifications per day. So you can kind of specify, and then you just click on update, and that's how that's done. So again, you go here, click on like, because I've already liked the page, and then the settings come up that allow you to kind of say, yes, show me all. Every time CMR goes live, I would like to see all of those. Okay, just FYI. Ooh, Lance Jefferson got engaged. Wow, congratulations, September 25th. Oh, I missed that one. Didn't see that before. Congrats. All right, folks, a little tech lesson here for you. Sandy says that employers need to stop covering up for people and their nasty attitudes, without a doubt. All right, folks, that's it. We're done for the day. Y'all have a blessed day. We'll be back tomorrow morning with more hot topics for you. So make sure you tune in live at 7:30 a.m.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.